Hi, everybody. I think I'm live. They're telling me I'm alive. I can feel it. I'm alive. I want to make sure that you guys can hear me. So go ahead and just type in the chat and say, yes, I can hear you. I see you typing where you're from. So thank you so much for that. Hello from Louise in North Carolina. Valerie in, I can't go. It's too fast. Lynn from Arizona, from Minnesota. Melody has an latex allergy. Oh my God, it's going too fast. Utah, and are you guys hearing me? I'm going to type it in. Nobody said they could hear me. Hey, hello. You hear me? Well, thank you for letting me know that. That's great. Good. I'm going to give everybody a chance to filter in. We got Savannah girl Sarah, and we've got Koha. He's from Singapore. Diane can hear me. We can hear you fine. Yay. Michael. We've got Sarah, Catherine, Woodlands, Los Angeles. Deborah, yay, hi. Louise, Melody, yay, Jay. There y'all are. D, Garrett, coming from Oregon. Jan from Oregon. Where else? Fairfax, Virginia. Patricia, yay. We already got a lot of stuff happening right now. Cool. All right. So there's a lot going on here. You guys have a lot that you want to learn here. I'm excited to have you here. I'm looking to see you guys. We've already got 124 of you in, and more and more of you coming. So yay. It's not telling me how many registered. That's kind of interesting. All right. Good. So are you guys ready to really dig into some of the things related to hormones? On other presentations, like last week I gave a presentation, and I kind of skirted on the hormones because we spent so much time talking about the genes, and that was really fascinating and fun, but I wanted to dig more into the hormones. And I realized that I really can't talk to you about all the foods that impact hormones because that's a long, long talk. So what I wanted to do is pick 7 of them. I called them my top 7 foods, and I think they are top 7. They may be among the top 10 or 12. We may disagree about which ones are actually better because it's going to be depending on the person, But what I really want is for you to do a deep dive into why these foods are important, because your patients are going to ask you, your clients are going to ask you, well, why are you recommending brassicas? How does that work? Why are you recommending this, black seed oil or turmeric or whatever else you might be recommending? And I want you to be able to explain that, but I also want you to be able to understand so you can choose the right combination of foods for the individual client, because we don't live in a one-size-fits-all society. Even though they try to sell those big dresses, those moo dresses, oh yeah, one size fits all. I mean, come on, I'm small and somebody else is large. It's not going to look good on us all. It's just going to maybe fit. Same thing with diet. So let me go ahead and make sure that we're starting. Well, I guess we are. I need to start the Zoom because we're going to put a cross thing on Facebook Live. So let me go ahead and start that. And if you want to share this information with your clients, well, not so much your clients, but your colleagues more so, then you're welcome to go ahead and share it. I will have it will be up on Facebook Live in just a few minutes. Let's see. And I have to, let me see if I can find it. Recurring. We have so many. Screen share. Facebook Live, the power of food is medicine. Here we go. So I'm going to start that, and I'm going to put that, and that's the other camera, so I'll bring that over closer so they're both right there. And I'm going to go ahead and put it on Facebook Live, and then we're going to jump right in. So I'd love to hear from you, what is it that you would really love to learn as part of this? So go ahead and type that in the chat. What is, if you could walk away with one thing, because you know what, if you spend an hour with me and you can walk away with one actionable item, it will be worth it. That can change your life. That could change the life of your clients. So what would be one thing that you'd really like to get a handle on in our time together this evening. So go ahead and post it, and I'll go back to it, and I'll take a look at those in a little bit. So I'm going to post it to our INE page. I'm going to go live. It's going to tell me when we go live, and I think I'm going to have a problem with, let me go ahead and change something on here because I'm going to make sure that I don't hear it. So hello, everybody who's on Facebook Live. You're going to see me turning away. I'm going to make sure I don't have your sound high. So I'm going to turn that off right now. So hello, there we go. Good. All right. So I got that turned off. So welcome to our Facebook Live page. Welcome to our webinar. And I know there's a combination of folks on both platforms. And we have a way to type in your questions and your comments on both platforms. So I'm just really, really excited to be here. And I'm going to put that down. Oops, it won't let me do that. All right. I'm excited to be here to share with you because I'm passionate about this topic. We have some slides, and I will share my slides in a little bit. But I just want to start out with figuring out like who's here and what is it that you want to accomplish by being here. So if you're on the Facebook page, then I would highly recommend that you go ahead and just type in like where are you from and what kind of practitioner are you? I'd love to hear that from you guys here. If you're not a practitioner and you're just here for your own sake or for helping your family members, then that's fine too. Know that we will do some deep, somewhat geeky stuff. So if you're not a practitioner, you may be going, but hang in. There's still going to be some really good actionable stuff that you're going to learn here tonight. So I would love to hear from you both on the Facebook and on the other. And I'm going to look to see if I'm actually seeing who's here. Let's see. I can see who's on there. Sometimes it shows me and sometimes it doesn't. Let's see. We have 11 shares so far. I see Paulo on Facebook. I know most of you are probably here on the webinar. So, all right, good. I'm going to just see, there we go. And that's the way I see it. So we've got Paulo, we've got some likes. So if you're on Facebook, go ahead and just put your little arrows and your hearts and all that kind of stuff. And we'll see you there. All right, so I'm going to get started. So we're here tonight to talk about one of my favorite topics. It turns out I love nutrition and I love hormones. So, and I love the concept of food as medicine versus our pharmaceutical system that the Western medicine practices. I really like the idea of using foods as medicine. And that's a kind of a cliche that's used, but I like it in that it's something that goes back in ancient cultures where we talked about using food as medicine. I'm not a fan of the concept of medicine, though. I'm a fan of the concept of prevention and balance and creating an organism, a body that doesn't allow for disease to flourish. But we all know that there's a time in our life that's before right now or before the time when we became aware that our food makes a difference. And you're going to see that with your clients. There was this, like I would say, pre-nutrition awareness day. For me, my pre-nutrition awareness days were somewhere between the ages of when I was born and age 24. For some of you, that might have been from age when you were born to age 48 or 52 or 65. Regardless of where that is in yourself or your clients, your patients, or your loved ones who you were trying to help, there's a point where things start to shift. Now, the reason that it becomes important, like how long was that period of time up until then, just really is how long a person's been able to hit themselves over the head with a hammer repeatedly and develop some problems and some imbalances. So for me, when I was in my 20s, I was 24, 25, I had 24 or 25 years. And at that point, it seemed like a lifetime because it was to me. But from now, it's like, wow, I've lived more than half my life, a lot more than half my life in this nutrition awareness phase. So I was able to undo a lot of the dysfunction that I had as a result of my poor diet, my poor choices, my stress levels, all the things that happened up until then. If you're working with somebody who comes in and they become aware at age 85, recall that there's a lot more damage that could have been done. And the degree of improvement you're going to see is not going to be as rapid or as dramatic as someone who comes to see you in their teens or 20s. It just makes sense, right? How long the dysfunction and the obstacles have been in the way. But know that I've worked with people of all ages, and you will see changes when you can get them empowered to make the changes. So there's a couple of things that go into you being an effective practitioner. And we're going to chat about that tonight, as well as go in depth on these 7 foods. So I picked the 7 top foods with healing powers and balancing hormones. And I do a lot of research, and I have Google alerts that tells me about when there's new articles about various things. And I've been excited by some of the articles that I've seen recently. And I scroll on other people's Facebook pages and, various and sundry organizations and people who are doing research. And I like to keep up on the foods. But as you're going to see, some of these foods are not brand new, hot off the press, but they're new uses of foods that have been a mainstay of a lot of folks for a long time. So we're going to be talking about food as medicine in action, right? In action with balancing hormones. So I keep wanting to get way ahead of myself. I'm going to share my screen. And I'm going to share it on, share. And we're going to get my slide, and you'll see in a moment. And if I say share screen, and I give it this PowerPoint presentation, yes. Right. So you should be seeing my screen share. I'm hoping that doesn't look like it got shared. There it goes. Yeah. All right. Perfect. So you should be, whether you're on Facebook Live or whether you're on the webinar, you should be able to see it. This is a workshop kind of thing. It's going to be a training, and we'll have some interaction. We'll have time for interaction. And it's basically the food as medicine. So for me, all that stuff you're seeing in this picture in the background, that's all part of your pharmacy, so to speak. And there's a play on the word pharmacy. Instead of PHIARM, it can be spelled FARM, pharmacy. And a lot of the foods that have been finding to have so much healing power when it comes to hormones, but also lots of other stuff, are found in that pharmacy. So before we go too far, I'm going to get real excited and want to jump up and down and talk to you about this stuff. I want to make sure that you're aware that everything that I'm presenting tonight isn't intended to replace a one-on-one relationship with a qualified healthcare professional, and not intended as medical advice. So if you're working with a client or patient, or you're doing this for yourself, you have to keep in mind that they may be under the care of an endocrinologist, an oncologist, a primary care doctor who's prescribed some sort of medical intervention, whether that be hormone therapy, whether that be some sort of medications and anti-inflammatories, etc. And so you just have to make sure that you're at full disclosure with them, that everything you're doing is a matter of education, whether you're looking at their labs and educating them about their findings, which might seem like a medical intervention, which it's not, as long as you're reading their labs and educating them about the findings, and then educating them about some of the research behind how they can intervene and restore balance there. So I know there's a lot of talk about our boundaries. So whether you're a health coach, a nutritionist, a dietitian, a doctor, a nurse, you have different scope of practice. And in any case, you can always be safe, regardless of your scope of practice, by education and empowering people to take charge of their own health. And that's what I think is the future of healthcare. It's the present of some of us in healthcare, but it's really the future of healthcare. So if they're under the care of a doctor, make sure that before they decide, well, I learned all this great stuff, I'm going to dump my medicine, that you actually help them to work with their doctor. You can counsel them, coach them on how they can approach their doctor if they want to do any of that. So they're weaned off gradually if they're going off medications. So I believe, and I teach this in my trainings, my practitioner trainings, the top 4 skills that all health practitioners need, regardless of what type, whether they're a dietitian, a nutritionist, an oncologist, a family doctor, a chiropractor, an acupuncturist, a nurse, regardless of where you are. Did I leave anybody out? A physician's assistant, a physical therapist, whatever you're doing, that you need 4 really good skill sets in order to get results with anything but the most simple cases, right? Complex cases are abounding these days because we have a very complex environment. So I want you to have, number one, superior interviewing skills, knowing what to ask and how to ask, and the power of why. We teach this in our nutritional endocrinology training. We have about a 10 or 20 hour module that teaches this to people. And we talked about it last year at our Shine conference, which is our annual conference for health practitioners. And it was a whole weekend of how to ask the right questions, but also the functional assessment tools. You need to have an understanding of how the inner workings of the body go. And so I'm going to share with the nuggets as much as I can related to that tonight as it relates to some of the foods that we're going to be talking about. But that in and of itself is a 36 module course that we teach in nutritional endocrinology, where you get into all the different organs and glands and how they work and how the hormones interact and how nutrition interacts. So really having an understanding of that. People who go to medical school or nursing school get a good grounding in that, but it's from a standpoint of conventional intervention, which is a disease model. And so I like to teach it from the prevention and balance standpoint. You also need some functional assessment tools. So the ability to look at their labs or to run different, or ask them to run specific labs or testing of their stool, of their urine, of their hormones, and be able to assess what's going on, what's going wrong. And finally, you need a complete holistic toolbox. And that doesn't mean that you have to be like an expert in every kind of intervention, but you have to be aware that there's different things that person might need. They may need some spiritual or psychological counseling. They may need some physical medicine type intervention. They're definitely going to need some nutrition almost all the time. They may need some sleep therapy. So knowing that you have a complete holistic toolbox, and that even if you don't have that skill set, you have an awareness of it so that you can work as a team with your clients to give them that broad range of approach. The problem I see, one of the problems I see with Western medicine, is that they don't have a lot of tools in that toolbox. And most of those tools are related to something like, medications, surgeries. They have various technological type interventions or assessment tools. But they don't really look at root cause and don't really address a lot of the time, at least conventionally trained medical doctors and nurses do not get trained in the art of using food and lifestyle and thoughts and emotions for helping people to heal. So tonight's presentation is going to focus strictly on one of the pieces of that holistic toolbox, right? To get more, there's, like I said, 36 modules and a 2-year training and hundreds of hours of training in that. And that's not something you should take lightly or say, oh my God, I'll never be able to do this because I don't have that training. No, you can have pieces of it. But if you want the complete toolbox where you're going to master a lot of the things in that toolbox, you need more training. So you don't have to, but you need to be aware that, oh, Dr. Smith down the street is really good with this psychological aspects. And this person over here does trauma therapy, and this person needs that. Another person over here is really good with homeopathic work. And I really think that it's beyond some of the nutrition I know, and I want to get them into this homeopathy practice or acupuncture or chiropractic or massage, whatever it is. But I think without a complete holistic toolbox, we become like the clinicians and the basically mechanics of, okay, we're just going to apply what we know to the problem. And so there's a saying that goes, if the only tool you have is a hammer, everything looks like a nail. And there's been a lot of patients out there that are getting substandard care because they're being treated like a nail when really they're a screw. All right. So you want to make sure that you're addressing people where they're at. And if you don't have the skills, that you have that in your network. And that's why I love coming together on groups like this. And that's why we do live events and bring people together, because it gives you the opportunity to meet other practitioners who share your passion for truly helping people get to the root cause, but have different ways in which they approach it and different programs that they have to address it. So it's really cool to create a network. So as you know, Hippocrates said a long, long time ago that let your food be your medicine and medicine your food. He talked in Old English and said, let food be thy medicine and medicine thy food. Okay, so basically food is medicine, but medicine is food. Okay, so I will say that that goes back a long way. thousands of years. And also the ancient Ayurvedic proverb, I'm not sure how old this is, but they basically say when the food is correct, medicine is of no need, because, right, the imbalance and food can be taken lightly can be taken as just the nourishment we put in our mouths. But I think food is also everything that comes in to nourish us. So it's the things we listen to, the people that we're around, the energy fields, the environment, all that stuff enters the body and either helps it or suppresses the functioning. So when the food is correct, medicine is of no need. But when the food is incorrect, medicine is of no use. And I'm sure you've seen that, where people go in there year after year after year taking these medicines, but nobody's addressing the root cause. So all of the things that I'm giving you tonight are about addressing the root cause. It's not about like, okay, so somebody has this hormone problem, we're going to use this herb or this food. That's a this for that approach. That's an allopathic approach. And we want to take a more integrative and holistic approach. So I look at nutritional endocrinology as one of the best ways to really balance the system. Endocrinology is the study of the glands, the glandular systems, and the hormones. And nutritional endocrinology is manipulation with that, with food and lifestyle. So it's not about giving somebody a pill. It's more about assessing what's going wrong functionally, like functional medicine. Functional medicine is incorporated into nutritional endocrinology, finding out from them and doing a really thorough history, but connecting with them, and then applying therapeutics that address the root cause. Is it a nutrient deficiency? Do they need more sulforaphane and you're going to give them broccoli? Do they have some hormone imbalances that will benefit from particular foods, lifestyles, and other practices that they can do? So that's what I see as nutritional endocrinology. And I see that as the future of medicine. It's combination. I see it as a combination of functional medicine with the assessment tools. And then instead of just, okay, we need this nutrient or that nutrient, really looking at how do we outline and design the appropriate diet, lifestyle, and attitude systems as well. So I consider as part of nutritional endocrinology, the attitude, the psyche, and all the rest. So that's what I'll give you as far as nutritional endocrinology. So you have a framework for the rest of this conversation. So I think endocrinology isn't a subspecialty. It's actually the master control system in the body. It's not a subsystem. It's the master control system. So we have, let's just say we have a neurologist and they study the nerves. We have a urologist and they look at the kidneys and the urinary tract, right? We have what's the word for the gynecologist who looks at the female reproductive system. But an endocrinologist is not limited to one part of the body. They're actually working on all the parts of the body because the hormones are discrete and throughout the body. They're not just secreted by glands. So endocrinology involves the glandular secretions that come from the digestive tract and the nervous system and the heart and the kidneys. They all have different glands, different endocrine tissue in them. They're not all endocrine glands. We have a discrete set of endocrine glands that we think about, but they're secreted like leptin. It's an endocrine hormone. Guess where it's secreted? By the fat cells. Okay, so hormones, they're everywhere. And we love the hormones and we need to really make friends with hormones in order to get the person balanced. So that's what we're going to be talking about today. And this is just a fun picture I gave you because it just is only touching the surface of the complexity of the endocrine system. Do you have to memorize every single one of those hormones and what it does? No. Do you have to be aware that these hormones exist and that there's functionally these hormones? Yeah, that would be great to know. But there's cheat sheets, right? There's a chart like this, and then there's lists that you can look up. But being aware, that the reproductive hormones are just one part of it. But when your client or patient says to you, I have a hormone imbalance, much of the time they're talking estrogen, progesterone, or testosterone. I actually saw that there's an acronym there, progesterone, estrogen, and testosterone. The PET group, right? Those are the pets. And those are not just the only hormones, right? We know about insulin and glucagon for managing blood sugar. We know about all the thyroid hormones for managing T3 and T4 and also T1 and T2 for managing thyroid function. We know about DHEA and cortisol and adrenaline that come from the adrenals, right? We know about the thymus gland. We know about leptin that comes from fat cells, and we know about ghrelin that comes from the stomach. And I'm just throwing these out at you. For some of you, you get it. You've been doing it for a long time. And for others, those are relatively new. That's okay. Either way, this presentation is a good one for you. Just want you to know that it's a complicated topic, and it is nice to know how they interact. Personally, I want what I call unstoppable health. I want to have the kind of health that makes me unstoppable, that doesn't have me saying, no, I can't do that fun thing tonight because I don't feel good. I have a stomach ache. I'm tired. I'm on my period and I feel miserable. No, unstoppable health is that ability of the body to respond and to be resilient regardless of the circumstances. Now, of course, we don't want to keep hitting the body with stressful circumstances because then the unstoppable health will go away. So I recognize that I have enough health and resilience that I can miss hours and hours of sleep for several days in a row if I have to deal with a sick relative, a sick pet, a deadline in my work. But if I keep doing it, that becomes abusive lifestyle. So we have to differentiate resilience to be able to deal with those extra stresses, but also the smarts to be able to be doing things that keep and maintain the unstoppable health. What I see and have seen in my practice of over 25 years is that there are a lot of people who are picking and choosing which of the health factors to actually work on for themselves. So they may come in and they're drinking only pure water and plenty of it, and they're eating only organic food, but they're not sleeping or they're stressed out all the time. So all of these things will interfere with health. And your job as a practitioner, as a health coach, as a doctor, as a nurse, as a physician's assistant, and any other of the health professions, your job is really to help that person to achieve unstoppable health. And like I said earlier, some people may be this far away, 4 feet away, and some people might be 3 inches away. And it depends on how long the quote unquote abuse has been happening. The imbalances have been happening up until then. But there's always things you can do. And to me, this is life with balanced hormones. These are my friends, the elders. They have to be over 90 to make it in this presentation, into this picture. And a couple of them are over 100. And two of them are over 100. The males are over 100. And the females are in their 90s. Can you imagine? You can tell by their faces and their hair color that they're out there, they're older than you and I are most likely, but they're still doing that stuff. You can't do that if your hormones are out of balance. You can't do that if your blood sugar is not in balance. You can't do that if your body is under continual stress. This is what I think we should be striving for, not just for ourselves, but for our clients. And the kind of care that I want you to be able to provide your clients is the kind of care that will result in this. And yes, you can say that genetics plays a part in this. Sure, genetics plays a part in someone's susceptibility to disease, but it's the lifestyle, the diet, the attitude, the stress levels, the sleep, and all the lifestyle factors that play into whether those genetics are going to be expressed or turned off. Okay? So that's what we're looking for. So just to give you a little review of the endocrine system, these are the major glands that we talk about. There are more, and there are more hormones way than this because you saw in the other chart, there's a lot more. But the pituitary and the hypothalamus is up there as well, but they are the master controllers. Hypothalamus is the master controller, tells the pituitary how to be the slave driver for the other organs, the other glands is what I think about. And they basically tell the other, they read the blood to see if there's enough thyroid hormone, to see if there's a stress response, to see what they need to do, see what time of month it is and what's happening with the levels. Do they have to stimulate the follicles for a woman? All of these things happen in these glands. So these are the major glands. But I want to refresh how these hormones work because it plays into how the food manipulation works with it as well. So we have a secreting cell, and the secreting cell is in one of those glands. It could be in the ovary or the testes or the pituitary. It could be in the digestive tract. It could be in the kidney. The secreting cell secretes the hormone, usually in response to testing the blood and seeing, is there a stimulation for it? Is there something there that says I need more, whether it be low level of that hormone or another instigating factor? And it secretes into the bloodstream that hormone, and that hormone travels through the blood and until it finds a target cell, and then it lands. Some hormones have targets on every cell in the body, like thyroid hormone. Some have the majority of their targets on particular areas like FSH and LH, which are stimulators for the ovaries or the testes, right? So they're all different, but the target cell then goes, oh, okay, I just got told a message. The thyroid hormone, the T3 that just landed on me, told my body, told me to turn up the metabolic rate, speed it up and make more energy. Great, I'm going to do that. Oh, I'm the ovary, and the target, the hormone landed on me and said, hey, produce more estrogen. It's getting to be that time of month and we're getting into fertility period and we need to raise the estrogen, right? So that's what the hormones do. They're just messengers. A friend of mine used to call them emails. It's like an email from one area to the other that tells the other area what to do. So this is just an overview and a review for a lot of you. But I want you to be aware, whether you know this or not, whether you've been to medical school or nursing school and you've studied hormones, the awareness that hormones control every single physiological and behavioral activity in the body. They're the messengers of life, and what they control are your digestion, the metabolism, growth and repair. Are we burning fat or are we storing fat? Are we adding new muscle, lean muscle, or are we breaking it down? Reproduction, mood, nutrient absorption. All of those hormones, CCK and secretin and all those that are produced by the digestive tract will affect the absorption of nutrients in the digestive tract, and also insulin levels, the immune system, stress response, the adrenal hormones like adrenaline and cortisol, the appetite, ghrelin and leptin play this little dance with each other. Cardiovascular function, fluid balance, and blood sugar. Now, you may or may not know all these right now, but like my point is, I want you to be aware of this, and there's plenty of ways you can go deeper with this. You can join me at our Shine conference. You can join our NEPT program or our CMDS or our IRSPT programs, our clinical mastery of the digestive system, our insulin resistance practitioner training, our nutritional endocrinology practitioner training, or come to our annual event. And you can also come to some of these webinars and learn, a basic. If you want to go deeper, those are the programs to look at. So I'm giving you the overview so you get why it's so important to keep hormones balanced. It's super, super important. So we are going to talk about a little bit about what controls the hormones. And this is where you come in. This is where you can make an impact. This is where you can empower and teach your clients how they can keep their hormones balanced. We already saw that how happy hormones doesn't just mean good sex drive and reproductive function. It means good digestion and brain function and stress response and metabolic rate and waistline and all the rest. So nutrients affect it, foods affect it. Stress it impacts it. I'm not even going to say affect or influence, but stress impacts it. The environment either impacts it or influences it positively, depending on the environment. Digestion impacts or influences depending on the environment. Sleep, lack of sleep will impact. Good sleep will enhance. And then other hormones, the interactions between the hormones. And you can learn more about all of this in our practitioner training. But for now, we're going to focus on hormones. And we're going to focus on the nutritional endocrinology hierarchy of interventions. I believe at the top of the list is food. So if someone has an imbalance of a particular hormone, let's just talk hot flashes, right? Person goes to the doctor. They have hot flashes. They may have some other signs of menopause. And the doctor runs a test and finds out that their blood levels of estrogen or progesterone or both or testosterone are low or on the low side. The average MD will then go to, oh, hormones are low, let's replace them. But look where that falls in my hierarchy. It's right at the bottom, right? What we really need to ask over and over again is the simple question, why? Why? Why is the estrogen level low? Why is the progesterone level low? Well, if you ask the conventional medical doctor who sees menopausal women all the time, a gynecologist maybe, they'll say, well, because she's 50. And I go, oh, so why are her hormones low because she's 50? They go, well, because that's what happens. It's called menopause and the ovaries slow down. But the point is that it's not a disease. it's a state of life. It's a transition of life. So that the symptoms are not really caused by the state of life. The symptoms are caused by an imbalance in those hormones created by something else. And your job is to look to find out what that is. I like to start with food. Starts with food. Lifestyle as well. Food and I consider food part of the lifestyle, but food and lifestyle. If you look at my pyramid over here, you see all these pillars, and these are the pillars that hold up the rest of the body. And if any of those pillars are crumbly, not working properly, what you're going to see is symptoms resulting. Right? So we want to look at food and lifestyle. Then we can look at herbs. We can sometimes look at it as part of the food regime. That's fine too. But I mean, when I say herbs, I mean like herbal formulations, tinctures, etc. I don't mean like food herbs. I like to look at herbs as foods that are culinary, and then herbs that are more of the therapeutics is really, let's just think of it as the ones that are too yucky to incorporate into food. The food herbs taste good. You can add them to your food. Ginger, turmeric, basil, oregano, all those things. So there's food and there's lifestyle. Then we can look at isolated nutrients, but we really want to start off with looking at how do we get the food such that it makes the nutrients come up to speed, and then the bioidentical hormones. Now, it doesn't mean that you can't do these things concurrently, because in some cases they come in and their hormones are so whacked out, they're too stressed out, and their hot flashes are too bad for them to even think about starting to make new food. So you can give the bioidentical hormones, right? Or you can get them prescribed and send them to a doctor who can, if you're not licensed to do that. But you've got to be looking at all the rest of this stuff at the same time. Otherwise, you're just giving them a Band-Aid. Okay, my buddy, Dr. Tom O'Brien, who I spoke to a couple of nights ago, I love the way he put it. He said, look, if somebody's struggling, they're drowning, give them a life preserver. But don't stop there. Don't leave them in the water with a life preserver and say, see ya, have a good life. You want to pull them out. You want to say, what's causing it? Oh, well, my goodness, there's a weight strapped to their foot and it's pulling them down. Well, the life preserver is not solving the problem. It's just keeping them alive, right? So we need to be able to intervene, give them Band-Aids. He calls them life preservers. I call them Band-Aids. I like the combination of the two. But you also want to be able to get to the root, and food is so critical. Food is something we can impact the functioning of our body with at least 3 times a day. So sometimes people eat only 2 meals a day or 1 meal a day, but every day we're impacting that, right? And we need to be able to look at how can we best utilize food as our medicine. Okay, so enough, wow, preliminary, and I got you through a lot of this, but hormone families are a good way to look at it. It's just families, right? That's instead of looking at it, that big chart of families, I like to break them up. We go into a lot more of this in our programs, in our nutritional endocrinology. But let's take a look at the top 7 foods with healing powers. And before we do that, I just want to say why I'm so passionate about this is, I didn't always have the energy I have. When I was in my 20s, I was exhausted and I was living on caffeine and sugar all the time. And I had some health issues, which I wasn't able to solve through conventional medicine. I asked the right question. Remember the power of questions. You have to ask the right question. And I said, could it be my diet? They said, no, I'm a rebel. I said, okay, let me prove that maybe it is. And I figured out that it was. But along the way, I wanted to influence my family. I wanted to help my mom and my dad, who were smokers and ate poorly and had some, minor health issues, and my siblings. I just wanted everybody to know what I knew, but they didn't want to know. So I watched my mom and dad suffer. Well, not really suffer, actually just die. Quite frankly, I would have been better if they had suffered, so we would have known that something was really wrong. They just had the standard aches and pains. But looking back, my mom had a skin cancer removed. She had gallbladder problems. She had kidney problems. She had arthritis. And she died at the ripe old age of 56. So she had all those problems before she was even in her 50s. But no doctor said, Mary, there's something out of balance here. You're young. You shouldn't have arthritis when you're in your 30s. You shouldn't have, kidney problems or gallbladder problems. I mean, the gallbladder problems is a common manifestation, female fat fertile in 40. So at 40, she had 9 kids. Oh, she had 8 at 40, and then she ended up getting pregnant when she was going through menopause and had a 9th kid in her 40s. So she was clearly fertile. She wasn't really fat. She maybe had a little extra weight around her middle, but damn, she looked good for someone who just had 8 kids. She did not look like, she put on weight every kid and looked awful. But the other subtle signs. You can't just tell by what somebody looks like, right? Her hair was gray quite prematurely. And there were just things that nobody good. And so she died. She died suddenly on my birthday at age 56 because she was into this medical model of modern medicine and disease, which is, we just keep doing what we're doing until we end up having to go in the hospital and they'll keep us alive and everything's good. But in reality, it wasn't good for her. And she suffered. And there she is a month, 3 weeks actually, before she died on her 56th, well, my 56th birthday. On my 35th birthday, she was 56. And this is her with my dad. She's not drinking a green smoothie. It's a green beer. It's St. Patrick's Day. And they were arguing about Italian versus Irish, which she was Irish, right? So this was her at age 56. This is my dad. He only outlived her by 2 years. He was a little older, so it was really 8 years. He was 6 years older. So he was 62 in that picture, and he died 2 years later. Broken heart, but also all the stuff. But you can see that neither one of them was obese. They had a little extra weight on them and nothing terrible. So it wasn't like, oh, you've got to lose some weight and get better. That's my sister. She was obese. She was 5 foot or 4'11", and she weighed 200 pounds over. It's like 250 pounds. She was clearly obese, and she never was told that you have to lose this weight. And it was never explained to her that it's not normal to be popping Maalox and Tums and all kinds of drugs all the time. She just was trying to get better, and that's what she knew. She watched TV. That's what they said to do. So she didn't have any fresh foods. She didn't take care of herself, and she had lymphoma, and she died. Not that long after my parents did. So I would say 2008, my dad died in 94. So 2008. So it was 14 years later. It was quite a bit later, but she didn't make it past her 44th birthday. And I know that these are preventable things. And I know that you're going to see people in your practices or in your families that have similar pathologies to them. Yeah, they have some bad genes. I have their bad genes. So I looked around and said, holy cow, I probably have bad genes. Nobody lives long in my family. So I take care of myself really well, like meticulously crazy. But here in the picture on the other side is me and my son when he was going off to college. That was 5 years ago. He's now off to graduate school. This was me at 56. Okay. I think I look a heck of a lot younger than my mom did in this picture. And it's not because I didn't inherit her genes. I have a lot of her facial features. You can see a lot of me, her and me, but it was because I made a decision to learn this stuff and take care of myself. And that's what I want you to do, is to learn this stuff and take care of you so that you can then take care of other people, and that we can be this wave that's spreading and spreading and spreading, where people are like, okay, what about the food? I've got to change the food. I've got to change the attitude. I've got to change the lifestyle because I have control of this stuff. We all have control. And I promise you we'll get into the specifics, but I wanted you to know that. And this is my family, and this is why I do what I do. I want to be around for these guys. It was really heartbreaking for me, to have children and have my parents never meet my children. My oldest son was born 6 months after my dad died, 2.5 years after my mom died, almost 3 years after. No, it's 3 years after my mom died because he was born in April and she died in April. So 3 years later, they never got to meet their grandparents. My parents never got to meet my kids, and I never got to have that, hey mom, what do I do? I've been up all night, I need sleep, get advice from mom about having kids. So I want to prevent other people from having this stress, and that's why we do it. So stop with the pulling the smoke detector out. The Band-Aids are like the alarm goes off middle of the night, and you're going, oh, that's keeping me from sleeping. You wouldn't go in and pull the battery out and then have the house burn down. You wouldn't do that. But you do it with the body, and your clients and patients are doing it with their body. Every time they take a medication or even an herb to suppress the symptoms without going deeper. So I'm not against Band-Aids, life preservers, however you want to call them. I'm totally about that. But I know we've got to get to the root cause, because otherwise these people's house is burning down. And the thing is, it's burning down silently when you shut the symptoms off. So all that inflammation and tissue breakdown is happening in there. And you have the power to change that with people. You have the power to show them, to teach them, to empower them to take charge of their life and not rely on Western medicine, which is the most amazing medicine system for trauma, for acute crisis care, right? You somebody who's got 106 fever and they've been in the jungle, get them some antibiotics, get them some medical care. You have somebody who falls off a roof, breaks an arm, is bleeding from orifices. Don't take them to the naturopath or to your office for health coaching. That's not what they need. They need intervention, right? Certain cancers, once they've gone beyond a certain point, you need to have them removed. But what are you doing to prevent it from happening again? What are you doing to clean up the underlying? That's where you have the power. That's where you uniquely have the power. And I want you to see this. And I want you to think about it every time you're thinking, like for yourself or a family member, well, they have this symptom. What should I do about it? Really, it's a lot of the same basic stuff. And then there might be specifics to restore their specific imbalance. So that's what I'm going to talk to you about, some specific foods tonight. Well, is everybody committed here to not allowing the houses to burn down, to not allowing people to just like get messed up from the inside out because they just want the symptoms to go away? And again, I'm not against Band-Aid care. I'm not against throwing them a life preserver. But I am against just throwing them a life preserver, putting a Band-Aid on and say, see, you have a good life. That's what I'm opposed to. We need to get people out of pain so that they will be able to do the things we want them to do. But we also need to be able to get to the root cause. Is this making sense? So give me a hey if this is making sense to you. Is this making sense? Great. I don't see, but yeah. All right, so I have a few questions coming in. I promise you I'll get to your questions. All right, so let's look. So I want you to get the most out of this. So I'd love it if you turn off your cell phones or put them aside. You know, I know you may have kids that may want to text you in the middle of this, but just don't be sitting there looking at your Facebook posts. And there's a lot going to be here. And maybe so far you're going, oh, she hasn't said much yet. I have said a lot yet. I have said a lot, because for you to empower your clients is where you have to help them to make a paradigm shift. And I'm helping you to make a paradigm shift. We're going to go into the details. What I want to let you know is that have some paper handy. We're going to take notes. At the end, I'll tell you how you can get copies of the key slides. I'm not going to give you all my slides. You don't need pictures of houses burning down. But I'm going to give you some of the charts, because we'll see some charts. I'll give you that, and I'll give you a link to that at the end. Okay? So have a paper and pen handy. Stay focused. Keep an open mind. Because just because I say one thing that you say I already knew, if you say I already knew that, you lost the next bunch of stuff. So keep an open mind. Share it with your colleagues. Go on Facebook if you want, and just do this. Share it. You can share you can say share on the Facebook page, or you can just go to your Facebook and type in, you know, hey, check this out, drritamarie.com/vibrant/food-4-hormones. drritamarie.com/vibrant/food-4-hormones. And if you're on the Facebook, please like it and share it with your friends, and send me some hearts. I love that. I love seeing the hearts. Let's see who's on Facebook. I can't see. I don't know how to see. Okay, there we see a bunch of people. Kelty and Doreen and Lynn and Jenny and Debbie and Paulo, and there's a bunch of shares too. So share it. I really would appreciate that. And I see some fat likes. Send some hearts and likes. They say that hearts get more popular press. So especially like if you're on a Facebook and you're trying to, you know, kind of get people to know you. Yeah, there come the hearts. Thank you, thank you, thank you. Appreciate you. All right, so let's just go ahead and jump in. So you want to ask the question, is your client's diet creating hormone harmony or an all-out war? Some people have those time bombs just sitting on their plate. And one of my patients, when I asked her how, so I was asking her about her history, and her husband had been deceased. And I said, how did he die? She said, he died by his fork. Cool, right? I mean, at first I'm like, he died by fork. And I'm like, somebody stabbed him? No, he died by what he put on his fork. And what we put on our fork either makes or breaks us. The so-called healthy diet, this food pyramid that came out in the 90s, it's a hormone and health disaster. It creates hormone imbalance. It's focused on, you know, all these servings of grain that is not necessarily whole grain. And it's carbohydrate rich. It can be spiking insulin levels, which damages blood vessels, which throws the brain off, which contributes to cancer, which contributes to all kinds of hormone imbalances. So this is a disaster. It was said to be a disaster. It was predicted by Louise Light to be a disaster if it got passed. But guess what? The food lobbyists pushed for it, and it's there. And what people think is a healthy diet is actually creating imbalance. Food is the medicine that is the magic to get to the root cause. And that's what we want to get to. We may not find a root cause like, oh, this person has a deficiency of this nutrient and that's what the cause is. No, it's a composite of causes. And usually it's rooted in poor nutrition, overnutrition, and a lot of stress. And it's stress in some way or another. So the end of the workshop, I want you to be able to know why food should be the first approach to hormone balance rather than the last-ditch effort. And I think I've kind of gone through that one already. What the latest research says about the healing potential of these top 7 foods and restoring balance to thyroid and adrenal hormones, leptin, insulin, and sex hormones. And I recommend you take some notes. And again, I'll tell you how you can get access to the slides at the end, the slides that have the charts of that. How to determine if your client is a good candidate for food-based interventions, and then how to teach them delicious ways to incorporate these healing foods into their diet. So for each of these 7 foods, I'm going to talk to you about ways that you can healthfully, deliciously have people incorporate. Sometimes what I do is I get out and I just do a food class, and I do them online once a month. I do them in my kitchen. If you haven't been to them, just make sure you're on our mailing list and we'll send you an invite. But I'll say, okay, we're going to do this thing about a certain food or a certain restriction, and I just throw all the food on my counter and I allow myself to create, because I somehow I've been blessed with a gift to be creative. Some people can paint and some people can sculpt and some people can write beautiful poetry. I tried my hands at those things and I'm okay at them, but I'm really good with food. So I do that. Then how to deepen your understanding of the power of food to balance hormones, get to the root cause of their chronic health challenges, and then offer proven effective strategies that are based in science and natural wisdom, and help you with those. So let's just look at the hormone imbalances. We're not going to look at all of the ones that I talked to you about before. There's something shimmering at the top of my screen. I wonder what that is. Okay. I don't know if you guys are seeing it or not, but when I look at the screen the way it says you're seeing it, there's like this flashing thing at the top that shows like some icons and whatnot. So I'm not sure what that is. So anyway, these are the main hormones that we'll mention throughout the presentation. There are a lot more, but these are some of the main ones. And when you're working with somebody, you want to identify, do they have imbalances in the thyroid, the adrenal, insulin levels, leptin, estrogen, progesterone, testosterone, DHA, digestive system. These are the main ones that I think make a huge difference. Okay. All right. And that was what I was seeing on Facebook. So I'm not sure if you're seeing it on the webinar gem. Let's see. Nope, it's not there. Interesting. The thing about it is that order does matter. It's not just a matter of like, okay, let's just balance their hormones. It really does matter. The first thing you need to do is help them transform their stress, because the stress is what's depleting the hormones and the nutrients. So we need to teach them techniques to help them to transform stress. Then I think healing and optimizing digestion makes a huge difference. I sometimes toy between, do we do digestion first or blood sugar first, because they feed on each other. So digestion and blood sugar are really important. Repair and recharge the adrenals, and then protect and heal the thyroid. Once you do that, chances are good that the estrogen imbalances repair themselves. Chances are good that the organ imbalances, the cardiac stuff, all help to get nourished. If not, then there's ways to address each of those. But I feel like this is the core basis for what we do. And these are some of the hormone balancing hierarchies. So we're going to look at the hormones that related to digestion: secretin and CCK, cholecystokinin. There's also gastrin and a whole bunch more. Blood sugar, insulin, glucagon. Stress response, the main ones that we'll look at are cortisol and DHEA and the balance between them. Thyroid, T3, T4. The sex hormones, estrogen, progesterone, and testosterone. I think I'm going to start writing those in progesterone, estrogen, and testosterone, so we have the PET. And then any organ-specific stuff. So this is how I proceed through, right? And it doesn't mean that if somebody's got a major adrenal imbalance and they're producing way too much or not enough cortisol, then I won't help them with the nutrition. But generally speaking, that comes under the handling the stress response. So we're going to take away some of the stress. I always think about, like, people talk about detox. What's the food for detox? What's the nutrient? What's the herb? Like, the first step is reduce the toxic load. And that's similar in here when we're talking about the imbalances here. We need to take the stress off the system, because the stress on the system is what's causing this. The stress could be nutritional stress. It could be environmental stress. It could be mental and emotional stress. It could be relationship stress. There's a lot of things that could cause distress. So we as practitioners need to help a person just identify the stress right up front. So you might have come from a medical model. Maybe you're a nurse or a doctor and your approach is, oh, well, I don't want to do drugs anymore. What herbs should I use for hot flashes? What's the best approach to low thyroid function? But it's really a matter of balance from the bottom up. And there are certain foods that help balance hormones better than others. So we've got 7 of these foods that I really like a lot. The first one we're going to talk about is mushroom. And here's the thing. For any of these 7 foods, you're going to find somebody in your tribe that's going to say, well, I can't have mushrooms, I'm allergic, or I can't have broccoli, I'm allergic, whatever. Good, fine. Oh, okay, well, look at some others, right? Just because somebody can't have one of these foods or thinks they can't have one of these foods, it doesn't mean that you don't have an approach. This is not an all or nothing thing. We're going to find and balance a person's diet with specifics about how they tolerate food. And a lot of stuff goes into that. And a lot of people who think they're allergic to mushrooms because they've been told that they have candida and mushrooms are a fungus similar to candida are not having a problem with therapeutic mushrooms. Not to say I don't see people who are having problems with therapeutic mushrooms like shiitake and reishi and all that, but it's less than the people think. But you have to work with them where they're at. So if they don't want to do mushrooms, good. You can explain to them. One of the biggest benefits of mushrooms is that they balance an enzyme called aromatase. Who's here's heard of aromatase? Have you ever heard of aromatase inhibitors? And aromatase, I know somebody on here that I just saw that I've looked at his Dutch test and he has a problem with aromatase. And so listen up, these are some foods that might help it. So aromatase is an enzyme that converts testosterone to estrogen, and specifically estradiol, not estrogen. Estrogen isn't one thing, right? Estrogen is E1, E2, E3. So you guys have heard of this, right? So there are a number of foods that affect aromatase, and mushrooms are one of them. And it's not just, all mushrooms, but it's not just one mushroom. So shiitake tends to be the best, but the little white button mushrooms are good, and the enoki mushrooms. So mushrooms can be really beneficial for balancing aromatase. In addition, they're helpful for the immune system. So if somebody's got hormonally inflammation-induced hormonal imbalance, like a Hashimoto's thyroiditis or some sort of other imbalance there, you can help them to get results. The thing about testosterone going to estrogen is that men tend to get what we call moobs, right? Male boobs. And when you see a man who comes in and they look kind of fit, but they have they have more than pecs, they're like boobs, we're thinking aromatase, right? And you can get it tested and you can do Dutch testing and all this sort of stuff, but you need to help people to get this under control. It also causes extra belly fat because estrogen helps to store fat around the belly. Okay, it causes feminization. It causes males to lose some of their oomph, their motivation, their maleness, and it causes females to get more prone to cancers, estrogen-sensitive cancers like breast cancer, endometrial cancer. Okay, so this is an important thing to look at. So the mushrooms that will help us to not make so much aromatase. It inhibits the action of aromatase. I showed you this because I wanted you to see the complication of these steroid hormone pathways. And there's a lot of places in here we can intervene nutritionally. And I can't talk about all of them. I do that in my 2-year program. And we do it more at Shine. We have 3 days together. But in an hour here, and I'm already close to my hour and going over, we can't really do it. So we've got cholesterol going to pregnenolone down to down here, testosterone to estradiol to estrone, and then estriol. Okay, estriol is the one we want, but a lot of times it just stops at estradiol and estrone, and those can be the proliferative estrogens, estriol. Anyway, that's what's complicated about it. And when we look at aromatase, can't twitch it. There are a number of things that can help it. So I just threw this in here as an extra, and I gave you a link, and I'll give you this slide when you opt in at the end, and we'll give you that link. Celery, olives and olive oil, avocado, nuts, cruciferous vegetables, parsley, allium, the garlic, onions, scallions, chives, and leeks, flavones and flavonoids from a variety of plants. So if you are looking at people's hormones and you're seeing that they are estrogen dominant, and the estrogen is dominant over the over on top of the testosterone and progesterone, then it's a good thing to be looking at, do they have an aromatase problem? And Michael wanted to know, how do you determine which mushroom? Just go do the research and whichever one they'll take. Shiitake does tend to be the best. Shiitake tends to be the best. Okay, I said shiitake, the white button mushrooms, and enoki, which are those little skinny ones. Those are the ones that have the most studies. It doesn't mean that, reishi has a lot of studies with hormone balance. Chaga, very good with the immune system. So all of them can be beneficial. But if you want a simple one that they can buy at the grocery store, send them off to the grocery store to buy those white button mushrooms and the shiitakes. Shiitakes have a lot of other immune properties. You can also get dried shiitakes if they live in an area where they can't get them fresh. And you can get them and reconstitute them and put them in soups. Okay, so mushrooms, like really, really beneficial to do mushrooms, right? And I don't mean psilocybin and all those kind of psychedelic mushrooms. So there's a picture of some of them. So you can saute them. You can marinate them and break them down. I like to boil some water, pour it over some of the dried mushrooms, and then add some veggies and sea veggies to make a really nutritious broth. Right, so these are the ways. The one up at the top is cordyceps. It's a caterpillar mushroom. I buy that powdered as an extract, and I drink it, and it's really good for endurance and all. So you can match things up. I would say research on the particular food that you want to go into detail with somebody on, and see that it has other properties that match. If you're trying to choose between mushrooms that are only willing to do one food, and you're trying to choose to be which one, you can look up their properties. It's not that hard to do. We go through that a lot more. So seeds are another one. What do I mean by seeds? Well, pumpkin seeds, sesame seeds, sunflower seeds, hemp seeds, flax seeds. They're all seeds, and they all have properties within hormone balance. I don't have time to go through every bit of research for every one of these because we could talk for 2 hours on each of these, but I wanted to give you the highlights of each one way more than I could if I just gave you a list of 20 foods. So how do seeds actually influence hormones? Well, sesame have been found to boost progesterone. Flax tends to be a phytoestrogen, and it also provides omega-3. That seems to have gotten skipped on that line, but it provides omega-3 fats, which are important for all hormone pathways. A pumpkin will boost estrogen and decrease menopausal symptoms, and that was a link that I saw, a study that I saw. Sunflower helps to boost progesterone. Chia provides all the omega-3s, and so does hemp. Provides those omega-3 fats that are helping all the hormone pathways. It's really important. And also, hemp is a good source of GLA, gamma-linoleic acid, which is also as a part of evening primrose oil. So a lot of people take evening primrose oil for hormone balance. So that's some of the seeds. So these are easy for you to incorporate for people, right? You just have them start to put the seeds in their shakes or spread them on foods, on salads, on steamed vegetables. But there's a concept that's gaining popularity over the last few years called seed cycling. And the idea is that we balance based on the person's cycle, if for a female, their cycle. So the follicular phase is days 1 to 14, where the body's getting ready to ovulate. And in that cycle, we need more of the estrogens. So we do flax and pumpkin seeds, a tablespoon of each. So you can encourage people those first 14 days up until ovulation, they can take the fresh ground flax and pumpkin and put them on their salads or put them in their smoothies or elixirs or put them over. I love putting seeds, fresh ground seeds over steamed vegetables, put some herbs and stuff. It's yummy. It's delicious. Easy for them to do. And then in the luteal phase, starting around day 15, depending on how long their cycle is, to about day 28 or until they start to bleed, then you do a tablespoon each of the freshly ground raw sunflower and sesame because those help enhance progesterone, which is important for their lining of their uterus. In males, they don't have a cycle, but it can be helpful as well. So the recommendation is go from the full moon to the new moon, right? So we go full moon to new moon. They do a tablespoon of a mixture of flax and pumpkin. And then the new moon to the full moon is a tablespoon of a mixture of sesame and sunflower. So it's similar, we're just timing it differently. And this has been shown to be very highly effective. And there's some links, I'm going to give you some links to it. And I'll give you that when you give me your name and email address, I'll send it to you. So the seed rotation, this is a chart that shows it. So I just thought estrogen boost in that day 1 to 14. And I found this, there's a link to where I found that. And there's actually another, if you go to that link, you'll find a PDF that has a really nice description of it. This is I found it and there's the link. So it's hard to see it, but you'll have that link and you can just go there. But it's basically this beautiful chart that talks about not only, how to balance it with the moon and how to balance it with the cycles, but it talks about, being out in the moonlight and other natural things that you can use to help people with their cycles. So it's a really cool concept. And this is just showing chia seeds, but you can do this pretty much with any seeds. I make crackers out of them, flax crackers, chia crackers, combination crackers. You can make a porridge out of them. You can just sprinkle them on your salad. I would recommend grinding them if you're going to do that with the seeds. And you can put them in smoothies. You can make drinks out of them. There's a number of ways that you can teach your client how to use these. So here's some references. Again, I'll tell you in a little bit where to go. I don't remember it off the top of my head, the link, but I'll give you a link where you can get that, and you can also get some gene charts as well. So the seed cycling, these are some references that I found, and there's more, but these specifically worked with, dealing with menstrual issues. Okay, so that's seeds. Another one of my favorites is turmeric. I love turmeric. I love to get the fresh turmeric root, and I love putting it in smoothies and salad dressings. I make a really killer salad dressing that people actually love when they taste it. And it's tahini, which is sesame seeds. So which part of the cycle would that be good in, right? That first part. So tahini, and then some garlic, which is also a good aromatase inhibitor, and some lemon. And then I put in turmeric, a piece of fresh turmeric, a piece of fresh ginger. And then I usually put a pinch of sesame oil just to give it in, and maybe a little bit of salt. And cayenne if I want it spicy. Oh my God, that's so good. And it's easy, and it's a real nice hormone balancer. So let's look at how it helps to balance hormones. It got proven estrogenic activity. It mimics the activity of the hormone estrogen. It's got some antispasmodic action that can help people who have menstrual cramps and other cramping kind of things. It has the property of being an emmenagogue, so it can actually stimulate menstruation. It's mild and supportive uterine tonic, so it's uterotonic. It keeps the uterus nice and firm and tight. It's reported to inhibit the growth of endometrial cells, so, the cells that line the uterus, by modulating the secretion of estrogen. And also, it's really important in the liver detox and digestive support, and it improves the ratio of the 2 and the 4 hydroxyestrogen. And I'm going to show you a chart in a little bit so you understand what those 2 different estrogen metabolites are. So there's turmeric. I make elixirs with the powder. I'll put some in my smoothie. I usually put big chunks of that in my smoothie. There's other ways you can teach them to do is saute and put it in there. A dal, like a lentil kind of dish with the turmeric in it, very traditional Indian. So there's a lot of ways that you can empower your people to just add this food. Yes, of course, you can get it as a concentrated capsule. And if somebody has serious illness, like a cancer or some serious inflammatory condition, you might want to do that temporarily. But it's easy to get people to just incorporate these new foods into something they're already doing. So ask them questions. What are you eating? What are you having for breakfast? See where you can push in some of these foods. Okay. So I'm going to talk about black cumin seed and oil. And that there's been a lot of research on this one in terms of Hashimoto's, in terms of it bringing down antibodies and helping with thyroid function. Black cumin seed is also called black seed. So if you see black seed oil or black seed, it's the same herb. And it has a number of other names. Nigella sativa is the Latin name. And it has a constituent called thymoquinone that's known to protect cells from autoimmunity and speed the repair of damaged cells. So it's really important in somebody with Hashimoto's where there's antibodies and it's breaking down. They can actually repair the thyroid as well as decrease thyroid inflammation, improve the thyroid resistance, so improve the cell's response to T3, because a lot of people develop thyroid resistance, and it improves weight loss. So this is a really, really good one. So results of a double-blind placebo-controlled study on black cumin, Nigella sativa, black seed. This is an 8-week study. This is 8 weeks. So if you're working with people with thyroid stuff, listen up. The TSH dropped by an average of 2.29 points. That's huge, right? The TSH should be in the range of 2.29. We're having people drop it by 2.29. Their T3 increased by 0.14. So if we look at T3, we're looking at, let's just say a T3, free T3, the range of the ideal, the lower limit of the ideal range is about 3. So if they were at like 2.86, it went up to 3. So that's significant. The T4, even more significant. So it says to me, it didn't necessarily increase the conversion from T4 to T3, but it increased the T3 in itself. And I bet, I'm just thinking out loud, combination of black seed with selenium, like Brazil nuts, and with working on the thyroid gland could help. Now, these people were not given any other dietary advice, and they were not given any stress advice. They were just given this herb. So imagine the potential of adding this with some other things we know. But the T4 increased by 0.82, and that's significant. Anti-TPO, which is the anti-thyroid thyroid peroxidase antibodies, decreased by over 146 points. Now, people sometimes have it up to 50, and that's considered a problem with autoimmune thyroid. Dropped by 146 points. That says to me that people with the lower end can have a complete remission in 8 weeks, which is amazing. The other thing is VEGF, which is vasoendothelial growth factor, and it's attributed to cancer, and it's attributed to problems with the blood vessels. And that growth factor decreased by over 1,421 points. So huge. Plus, these people, without doing anything else, no other dietary changes, lost 2.9 pounds and half an inch around their waist without changing the diet. So I've given you a link to that NIH study in here. This is how you can get it. The study actually used ground black seed. So this is what it looks like when it's ground, and it's probably extracted. This is the whole seed. This is a bag of it. I found this on Amazon, and it's all organic black cumin seeds. I'll tell you a funny story. I did buy some of these. I was traveling and I went to store. Oh, let me try these black seeds. And I bought them and I, tried them, and I didn't do much with it. And then I forgot. And I was making my morning chia beverage, and I pulled out what I thought was chia seeds, and I put them in bag, and I put water in it. And about, half an hour later, I went to drink it. I'm like, wow, what's wrong with these chia seeds? These chia seeds aren't breaking down. It turned out it was my black seeds. So, they don't gel like a chia, but they can be used in a lot of ways. They can be ground, and they can be put in elixirs. They can be put in smoothies. It could be put as a spice on things. Black seed oil can be used as well. So you can sprinkle it. Just make sure that it's organic and that it's pure. Like it's guaranteed to be pure, because some of them are like mixed with other stuff and they don't necessarily say it. But I found these. I never used these before, but these are organic black cumin seeds, and they're from Turkey. So before I finish the last 3 foods, I just want to tell you about an opportunity, because it's getting late, and I want to invite you to learn more about this with me in our Shine conference. Some of you have heard about this before. Many of you are already signed up, but I just wanted to tell you a little bit more, because we're going to go a lot deeper at the conference, and you're going to get charts, and you're going to get protocols, and I'll share with you a couple of what they look like. But there's going to be an amazing, empowering event where you can come, and it's in November 3rd through 5th. And it's in Lost Pines, Texas, which is just east of the Austin airport, about 20 minutes. It's in a beautiful resort called the Hyatt Regency Lost Pines Resort and Spa. If you come early, plan on getting a massage. They have an amazing spa there. Plan on bringing your bathing suits, and they at least have some indoor stuff. But most of the time at that time of year, it's still kind of warm, and they heat the pool and the spa. We're going to focus on food as medicine and holistic healthcare. It's really your recipe for a fulfilling and thriving practice. So we're going to teach you how to incorporate this, how to understand what's going on, how to make the foods. There'll be food demos, but how to incorporate it and how to go out and teach this and start making money with your clients and earning a living so you can quit your day job, for those of you who are still in your day jobs. So like Hippocrates said, let food be thy medicine and medicine be thy food. And that's what we're going to work on. And you may be thinking, well, I already know about food. I don't need to come here. You are going to learn a lot. If you think you've learned a lot in the last hour and 15 minutes with me here, imagine spending 3 days where we can take our time, where we can go deep, where we can do some practical exercises, where we can talk cases, and we can really dig deep into this. So we've broken up the 3 days into day 1 is appetizers, day 2 is main course, and day 3 is dessert. And I'm going to just show you a couple of things, and then we're going to go on to the last 3, and then some general stuff that you can do. And I'll give you the link to where you can get more. So appetizers, we're going to learn how to assess for nutrient imbalances. So how do you know which imbalances they have? What foods they think are healthy but really aren't? The categories of foods that can deeply nourish, how to get them to use them regularly, and we'll have some demos. The myths about snacking and grazing, how to find out what works best for the client, because there is no perfect diet for everybody. We're going to have somebody, an Oriental medical doctor, talk about Chinese medicine and matching the foods to body type and how to incorporate those food demos into your practice. And that's as a way to attract people in. And I used to do that, and wow, I would get lots of clients from it. The main course you're going to learn on day 2, you're going to learn how to restore balance to the specific hormonal areas and the specific gland and organ systems, how to use them to help the brain, the digestive system, the immune system, the liver, the heart, and overall health and wellness. Huge. We're going to go really deep into the gut. We're going to talk about fermented foods and how to make them, but also how to get them the balance in the microbiome, which is going to affect them on every single level. We're going to talk about blood sugar and how blood sugar impacts their circulatory system in their heart, and how you can test and incorporate this into your practice, and how to incorporate elixirs. And we're going to show you some of those, my favorite ways to get people, because people love them and they drink them, and then you can get a whole bunch of herbs and nutrients in them. And then finally on the dessert day is what are you really going to do when your clients seem to be doing everything you recommend, but they're not getting the results? And we're going to have some really good discussion. How to use nutrition to go beyond the take the pill paradigm and really help them use food as medicine and address the diet, and how to go above and beyond and truly create a wellness mentorship practice with your client. And we have some guest speakers that day. We're actually going to have one of the things related to food and women's hormones is going to be on Sunday, because that's the only day our speaker could make it. Ideally, she would have been on Saturday, but she's not going to make it until Sunday. And then how do you really guide them? How do you put this into practice? How do you actually get them to do the stuff? And how do you attract clients to take this on? So you're going to get the training and lots and lots of workshops and sample plans and digital access to slides and charts and handouts and done for you protocol sheets. I mean, generally speaking, you're going to get a PDF or you're going to get PDF versions of all this stuff. So you'll see me using this stuff and you get copies of it, but you're going to actually get it so you can actually use it in your practice. And I don't know of anybody else that does an event that does that. That's a picture of me on stage with Mike Mutzel, who spoke at our 2 years ago. We're going to do food making demos, how to incorporate it, practice building tips, and you're going to get these amazing speakers. So those of you who were on my Facebook Live the other night heard Dr. O'Brien. He touched the surface as best he could in an hour. He's going to go way deeper at the event. Dr. Annika Becka with the female hormone balance. Dr. David Weinthal, who's going to talk about Chinese medicine principles. Steph Jackson is going to talk about how to choose the right fermented foods to get your gut balanced. And then Dr. Deanna Minich is going to talk about using the creativity in your practice to help empower your clients. And then finally, the mindset strategies that Tony has developed to really get them doing it, to make shift happen, as she likes to say. So those are our people. You go to shineliveconference.com and we're going to empower you. We've got some extra bonuses. We've got a VIP option, which I highly recommend you take because it's food the whole weekend long, but then some pre and post clinical mastery workshops. And at the event, there'll be 2 events, a breakfast, coaching breakfast, and a dinner, reception with the speakers. So you get to actually hang out with the speakers, which is really cool. And typically the price is $19.97 for the VIP version, which includes all the meals and all the pre and post. And we're discounting it to $597, so it's $1,400 off. And then the typical price on just the conference is $997. We've got it down to $397. I go to conferences all the time. The conferences I go to that don't have food are around $797, $800. The ones I go to that do provide food are usually $2,500 to $3,000, and they get it, and I do it. So that's it. What I want to let you know, because I have a slide on that later, is that if you're one of the first 15 to sign up, you're going to get an extra bonus. Let me see if I can find it. And then if you sign up within the next few days, for 72 hours, we are going to give you a coupon. So the coupon will be up on this slide in a moment. It's Shine VIP, and you'll get an extra $100 off if you sign up within the next 72 hours. But I'll get to that in a moment. But if you want to do it now, the first 15 are going to get an extra special bonus of a program I put together to help you with your clients, teach your clients how to balance their brain chemistry, the neurotransmitters, and all that. Whoops. Let me go back to from current slide. Oops. Nope, I don't want to do that. Somehow that got messed up. Let's scroll down, and I guess I can just show you real quick. Yeah, so there's the $100 off coupon. And from current slide, yeah, so the $100 off coupon, Shine VIP 100. That'll take $100 off. So if you go to shineconferenceevent.com, those of you who have been in programs with me before and you had qualified for a bonus ticket, you would have gotten a link. Just go ahead and sign up with that, and you'll get your bonus ticket. And we'll include the bonuses with you if you do that. So bonus wise, there was another bonus I wanted to tell you about. Then we'll go back to the other three foods. Yeah, so the quick action bonuses are last year's Shine event was recorded, and we have videos and we have handouts for that. And we're going to give you the entire video handout package, which is digital, online for a gift, just a gift to be a quick action bonus. Okay. And then we're also going to give you something called my brain program, which is learning about the neurotransmitters and brain function to guide your clients. So that's part of the quick action. So you'll get that over the next few days. And then if you're one of the first 15, we're also going to give you my entire collection of recipe videos. They're 3 hours long each. They have a beautiful guide with them. They're separated into each individual recipe. And this is just some of them. We have the art of gluten-free bread making, dairy-free cheeses, and a whole bunch more. So you'll get all of those, 14 of them in all. And you can learn a lot to be able to share with your clients, like how to make certain foods as they're transitioning off their allergens and things like that. So shineliveconference.com. My team can put up the link if you want to. Just put it up, and then you can just click it. Let me see. Over here, offer. Yeah, so it's up there. Just click it and there, and make sure you use the Shine VIP 100. It's only $100 off the VIP. The regular is just regular price, which is $397. Okay, so it's if you want to do VIP, do it. You'll just pay the difference right now. All right, so I'm going to go back to where I left off because I want to go finish these, and I apologize for this going too long. I just always have more to say than I have time to say it in. That's why I do events. Quite frankly, that's why I do events, is because I'm not cut off when I do the events. Okay. Okay, let me go back here because I can actually, plan more and get really in depth with you guys. So I've been doing this for 25 years and I'm passionate about food. So my next set of foods is fermented foods. You hear me talk about it all the time. You hear me talk about it in relationship to the, a lot of things, but in relationship to the gut, right? It's really important for the gut, but it's also super important for hormones. So let's look at that. So some of the fermented foods that I like, sauerkraut, cultured vegetables, kefir, nut and seed yogurt. And I make a variety of nut and seed yogurts, very easy to make, very easy to guide people through. Coconut, you get a coconut, you scoop it out, you put it in the blender, adds a little bit of water or the water that comes with it, add some probiotic powder, and then just let it sit overnight in a warm place at about 90 degrees or in a dehydrator or a yogurt maker. I do it with cashews. I do it with cashews and hemp, do it with all kinds of things. And those are amazing fermented foods. Not only good for the microbiome, but good for the hormones. So how? Well, they help to stabilize blood sugar. They help to reduce food cravings and keep the insulin sensitivity high. They affect those receptors on the cell. So really, really good. They aid in weight loss. They lower the BMI and waist-hip ratio. What does that mean? The waist-hip ratio is a sign of insulin resistance. So that's how they work with the stabilizing blood sugar. And it has to do with the impact of the hormones and the lining of the gut and how that interacts with the pancreas. It helps to drop total cholesterol and LDL bad cholesterol. So, and I think that one of the ways that some of the things that lower cholesterol is that they actually promote the conversion of cholesterol into the other steroid hormones. Because what I see when people use natural remedies to get their cholesterol lowered as opposed to a drug, they're actually seeing increases in their steroid hormones like estrogen, progesterone, and testosterone. and a decrease in their cholesterol. Lowers the fasting glucose and the hemoglobin A1C, but it balances the digestion. And the digestion influences the estrogen metabolites. So estrogen, estrone, estradiol, estriol, they get broken down and have to be eliminated when they're used. And there's some metabolites, you might see the 2-hydroxy, the 4-hydroxy, the 16-hydroxy metabolites. And some of them are good and some of them are not so good. They're not intended to have long lives in the body. They're intended to just be excreted. So there's the one that's the most damaging, that has the most effect on proliferation of tissue that's hormone sensitive, is the 4-hydroxy. And the 4-hydroxy should be 10% or less of the total. The 2-hydroxy is the most protective, and it should be like 80% or 70% or more. And then the 16, if it's too high, can be damaging, but it also can be very helpful for bone health. So we don't want a tiny amount of the 16. We want kind of an in between. The digestion and the digestive organisms, the state of the microbiome, impact that conversion and that elimination, right? The elimination of the 4-hydroxy is improved. The things that enhance liver detox, methylation in the liver, are going to enhance that estrogen metabolism as well. So just an aside. Leafy greens and sprouts. What else is there with leafy greens and sprouts? So let's take a look. Well, how do they influence hormones? First of all, leafy greens and sprouts are loaded with magnesium and other minerals. So magnesium is super important in the production of the sex hormones, progesterone, testosterone, and estrogen. Helps reduce hot flashes, magnesium does, by 50%. And a 250 milligram a day supplement has been shown to ease PMS by 34% over a 3-month period. And there's a link. So if we're getting all this magnesium from our leafy greens, and they're loaded with leafy greens, it stands to reason that it's going to help improve hormone function, in particular the sex hormone. But it's more than just the sex hormones. Magnesium is important for adrenal function, for thyroid function, and for insulin function, right? So it's going to improve the hormones by affecting those as well. So we can't keep thinking about just estrogen, testosterone, and progesterone. Broccoli sprouts contain DIM, diindolylmethane, and that detoxifies the estradiol. So it helps to break down that estradiol so we have the right ratio, and the right ratio of estrogens within each other, E1, E2, E3, but it also helps with the estrogen-progesterone ratio. And they contain the highest amount of sulforaphane of any sprout and any other of the cruciferous vegetables. And that helps to prevent breast cancer because of the effects on the hormones. The broccoli sprouts have been found to be helpful in so many cancers. And sprouts in and of themselves are really good sources of free-form amino acids. So overall, you're seeing so much benefit to the sprouts. There we are. We have sprouts, and these actually would make broccoli. So these are the broccoli sprouts. This is what they look like. And for somebody who can't get access to the sprouts pre-done and they don't want to sprout, you can actually take the broccoli seeds and have them grind them up and put them into their foods and get similar results. So it's really kind of cool that way. I know that Dr. Lodi does that at his cancer with his cancer patients and has really great results in improving the liver function. So here's some others. I mean, how else do you use the sprouts and the greens? Well, there's salads, right? There's lots of really great ways to do it. You can steam them, you can saute them, you can blend them into smoothies, you can make them into juices. There's so many ways to help people add these greens. And you can sneak them into things like crackers and cookies and desserts. I make a brownie, a kale brownie that people just die over. They absolutely love it. So be creative in helping people to incorporate, especially if they're one of those bitter tasters who don't like the greens. And the last of them is brassicas. Oh my gosh, brassicas are so helpful. The cruciferous vegetables, the broccoli, the cauliflower, the kale, the cabbage, and all those. So here's a list of them, and I'll include that in the slides that I'll give you, the copies of the slides. So there's a whole slew of them, right? Find the ones, experiment with people, and get them to try them. How do they work? Well, there's a substance called indole 3-carbinol. and DIM, and those specifically interact with the estrogen metabolism and breakdown, and the ratio of the 4-hydroxy, 16-hydroxy, and 2-hydroxy. So they're very good at getting the balance there to a healthful and protective way. They also contain sulforaphanes and glucosinates, which are affected by the gut flora. They promote the protective estrogen receptors, and I'm going to show you what those estrogen receptors are like. So the brassicas will help promote us to have the protective estrogen receptors activated as opposed to the non-protective and the safe estrogen metabolites. We see people who go on either the supplements of indole-3 carbinol and DIM, or more broccoli sprouts, broccoli sprout powder. However you can get people to do it, there's ways to do it, and you can add them to elixirs and smoothies. But we see the estrogen dominance go way down. The estrogen levels are improved. This is a chart that just shows you a little bit about the estrogen metabolism, and you can see that comes over here, androstenedione, and then over on the other side we don't see it, but testosterone comes in here, and these are the male hormones, and they come in and they get converted. And remember, we talked about aromatase earlier on. So we get the estrogens, and if somebody's low in magnesium, we're going to get more of the 4-hydroxy, which is very damaging. If they have good levels of cruciferous, which is the DIM and the indole-3 carbinol, they're exercising. They have some flax, maybe soy, depends on their sensitivity. Omega-3s and good levels of progesterone, which we looked at seeds, right, to help improve that. Then they're going to make more of the 2-hydroxy. And then if they have good methylation, they can make more methoxy, and that's really protective. But if they're obese, they have hypothyroid, they are exposed to pesticides and cimetidine, they make more 16-hydroxy, which can be proliferative, but it's also protective of bone. But if they have plenty of iodine, they're going to convert that 16-hydroxy into estriol, which is protective. So it's really important. You can see, the reason I love this chart is that you can see the diet and the lifestyle factors that intervene to help create balanced estrogen metabolism. Right? And this isn't just about estrogen, but there you go. So there's the group of these brassicas that are so important for not only estrogen metabolism, but good gut flora, etc. And you can steam them, you can saute them, you can make smoothies. There's so many ways to make them. Be creative with them. This is a little bit about the estrogen receptors. We'll go into more of this at our Shine conference, but the ER betas calm things. They protect the breasts. They inhibit the ER alpha, estrogen receptor ER is. Enhance vitamin D absorption, which everybody needs, and affects serotonin. The alpha, though, promotes the growth, proliferation, and we need some of that, but we just don't need excess of it. In excess, it can promote tumors. So we need it to do normal cell growth. It protects against brain injury. And it's blocked by selenium and protects the endothelium. So blocked by selenium. So we went back and said, oh, selenium's important. Brazil nuts are a great source of selenium. So you get people eating more of the Brazil nuts. So you see how it all ties back to food. And we also talked about how the brassicas affect and they enhance the ER beta production, right? So really good stuff. So just a quickie on some of the other foods that nourish the hormones, the nuts and seeds and berries and sea vegetables and omega-3 fat-containing foods, non-gluten grains like quinoa, coconut, sunflower lecithin. I put sunflower lecithin in particular instead of soy lecithin just because so many people are sensitive and so much soy is GMO. I did find this. We were using Lactose for our sunflower lecithin and getting it in a liquid form, and they don't make it anymore organic. So it's hard to get. And a lot of them are extracted, so be careful in buying a lecithin. A lot of them are extracted using hexane. So I just found this one. I ordered some on Amazon. I'll see how it goes, but it's an organic sunflower lecithin with no preservatives. So I'll see how it goes and I'll report back. And then pomegranate. You can get pomegranate seeds. They are a pain. There's only a short season. Or you can get pomegranate powder and have people incorporate that into their healthy lifestyle. Fats are super important. We need the right balance of omega-3 and 6. And we're going to talk in detail about that at the event. And I'll give you a really, really, really cool spreadsheet you can use. The other thing I'm going to talk more in detail at our Shine event is hormone helpers. We have a whole chart of those and all the different nutrients that help and support the hormones, and we'll go into why. And this bottom part is from a PDF document that has all this list of foods for the different organs and the different glands. So we're going to use this. You're going to get access to this at our Shine event. So we're going to just load you up. I can't give you all of this tonight. We just don't have time. You want to make sure you get them off the foods that disrupt, the charred meats, the high glycemic foods, the flour, the sugar, the grains, or certain grains, at least the gluten grains, chemical-laden foods, excess alcohol, caffeine, and hydrogenated fats. You just work them away from these slowly, and this is going to help them balance their hormones. You've got to get them off of gluten, at least temporarily while you're doing this transition, and then later when they get perfectly well, if they want to try it back, they can. And I don't have time to go into too much detail on this, but Tom O'Brien will go into this in regards to autoimmune function. And he did that on our Facebook Live the other day, if you want to go back and listen to that. The inflammation leads to adrenal stress, which the antibodies cross-react with thyroid. He talked a lot about molecular mimicry on that presentation. It was a couple of days ago on Facebook, so you can go back and listen. Malabsorption leads to nutritional deficiencies. It impacts estrogen and progesterone via the adrenal exhaustion pathway, and we'll go through more detail on that chart I showed you earlier. So when you walk away, you're going to master it. You're going to understand perfectly that chart. You're going to understand the estrogen metabolism. You're going to understand how to manipulate it with food and nutrients. The effects on digestion, gut flora, neurotransmitters, and it worsens at perimenopause, so we know. Here's some of the foods you can replenish with. I'll give you this in the chart. And how do you get the nutrients related to the food? And you'll get a lot of those charts at the event, like which foods have which nutrients. So when you find these nutrients from the assessments that will give you, you'll be able to figure out what foods to give them. Basics of sound nutrition. It's just whole, fresh, plant strong, nutrient dense, organic, essential fats, and free of preservatives, additives, and GMOs. How much plant versus animal is up to an individual person. Some people are ethically opposed to animal proteins, and that's where they're going to stay. Some people are ethically opposed to being without animals, but you've got to figure out the way. And I feel like if I look at all the research, 10% or less of the diet should be from animal products, and the rest should be from plants. Some people go 100% vegan, and I think you perfectly can, but you've got to work with the person individually. I've been doing it for 30 some years. I've seen some people who really do need that extra, a little bit of the animal protein because they don't do well without it. Or they don't feel well, or they feel like they're missing something. But everybody's unique, and you need to find that right balance. There's so many pluses and minuses, and we'll have a discussion about that at the event. Meal plan, you want it to be anti-inflammatory, like the gingers and the turmerics and the anti-inflammatory fatty acids in the fat, the nuts and seeds. Low glycemic for the most part, because unless they don't have to, and if you get them to get their own meter, they can measure it and see. Moderate protein, moderate fat, alkalizing, high nutrient density. We'll go through what all of this means at the event. I just wanted you to have it. And we'll also go through this chart, which I love, and you'll get this in a big 8.5 by 11 that you can actually keep on your desk and go through. So the different ways to balance the different components of the body. There's 3 things you need to be unstoppable, to be successful. You need to take care of you. You need to have clinical mastery, and you need to have effective business strategy and marketing. We're going to cover all 3 of these in our 3-day weekend. You're going to be taking care of yourself through the fitness and yoga breaks, the Qigong in the mornings, through the food that we're going to be serving to VIPs. You're going to get tons of clinical mastery. I just overwhelmed a lot of you tonight with so much of it here, and the effective business and marketing. And we're going to go through strategies for how do you actually put this into practice. So when you feel confident that you can really help people, and you can use assessments, and you can get to the root cause, you don't have to worry about feeling like you're a fraud anymore. How is that going to feel when you're actually earning a good living doing this with your clients and making a difference? The best way to grow your practice is not Facebook Live. It's not having effective marketing techniques, although those are important. It's really getting the results. And when you can unlock those difficult cases by using this food as medicine approach and get to the heart of things that people haven't been able to up until now, that's when people are going to refer, and that's when you're going to grow your practice. And that's why we created the Shine event. This is our 5th one. We have different topics each year. The videos are available if you want to purchase any of them to see what they were like. They're loaded with information, and you're going to get free copy of last year's videos when you sign up within this window. That's the concept. You're going to learn a lot. You're going to have great tools. You're going to have live demos, speakers, gifts. I'll tell you more about that in a bit. I already talked to you about the 3 different days on the appetizers, main course, and dessert. How to assess, how to get the meeting properly, what categories, myths about snacking, incorporating food demos. All of these things are super important in your practice for you to be able to take what you're learning and put it into place. We're going to give you the practical strategies to do that. You're going to learn how to connect the dots between the particular organ systems and the particular foods, and the gut, because the gut's the core of everything. Get their blood sugar balanced, and the healing powers of elixirs. We'll have a demo on that. You're going to learn what to do on that last day is how do you take this into practice, right? What do you do when you go home? This is not a theoretical process that you just go, oh, that was a great seminar, and you don't do anything with it. I want you to hit the ground running when you get back into your office and really start using this with people. Start to use some of the techniques we're going to teach about getting out there and doing presentations, doing some food demos to get people excited about what you do, and get people to really feel empowered. That's when you're going to make a difference. Okay? And if you're passionate, if you feel intimidated, you want to grow your practice, you feel inspired when you're around like-minded people, please come and join us. It's for all sorts of practitioners, dietitians, nutritionists, health coaches, doctors, nurses, and anybody who really wants to help others that may not want to do it as a career, but may be very passionate about helping their loved ones to stay away. And you need to be somewhat educated before you come if that's the case. All right, so we talked about what it includes, the days of training, the protocol sheets, the self-care breaks, the food making demos. The networking is just invaluable. We have people who met 5 years ago at our first Shine event, and they're still buddies, and they mastermind, and they support each other in their businesses. Our speakers, we talked about already. These are amazing folks with amazing reputations, books that they've written and summits that they've led, and they're just phenomenal people. Between, I think, every single one of them, most of them have run a summit. Every one of them except for Steph has run a summit. Steph runs online programs for clients. She runs online programs for practitioners in the digestive realm. These people are superstars in their business. So the VIP includes the lunches, the breakfast coaching on Sunday, the Saturday reception with the speakers, the preparation workshop in advance, and then 2 post-conference strategic workshops, a really cool goodie bag, and it's all yours at the rate of $597 today for the VIP, or $397 for the regular, and then just use the coupon and you'll get it down to $497. So I don't want to spend too much time on pushing this towards you, but if it's right for you, you're going to feel it. Really, the people that have been there have been amazing. Just go to shineconferenceevent.com and see what some of the people that have been there, medical doctors, acupuncturists, physicians assistants, and health coaches, all have said about how this event has changed their life. And I promise you that if you come and trust me for the weekend to get out of your home and get out of your comfort zone, it will be worthwhile. You will feel the difference, and you will make a difference when you go back into your practice. I promise you. So bonuses, we're going to give you last year's. This was our most popular one yet, the Mastering Functional Assessments. It's totally a phenomenal in-depth study of how do you use various lab tests, but also in-person tests to help support your clients. And my brain program, I know a lot of people talk about not knowing enough about the brain and the neurotransmitters, and this is a step-by-step system that you can use to help your clients. And those value of all those is $797. Go to Shine Live Conference, and I'm going to give the first 15 to register this complete gluten-free the library. It's 14 different ones of phenomenal food, and you can learn yourself, and you can watch how we do it, and then you can teach your clients. You can create your own series of course classes. Let me tell you this. I think that it's the best way to get people in the door, because when they start tasting the food, Then you start to talk about the health benefits and how it can help them. Then they're ears. They're all ears. When you just start talking about, changing your diet or getting rid of certain foods or adding certain foods, they have no clue what it could taste like. I remember somebody coming to my class. I taught this class and I'd been just counseling her on and off, but I couldn't get her to do what she needed to do to get off of gluten and a couple of things to heal her hormones. And she came to my pizza making class, which you'll see in here. There's an Italian one that will teach you how to make pizza. She came to my pizza making class and she came up to me. She goes, I can do this now. I can do this. She immediately, when she did a raw cleanse for 30 days, just eating great raw food. It wasn't like a deprivation cleanse. It was just eating nothing but raw food for 30 days. And she lost 20 pounds and she converted her kids. Her kids got over their ADD and all kinds of stuff because she came to the class and she said, you know what, I can do this. And then she brought her kids to a class that I did for kids and parents. And the kids were like, okay, Mom, we're ready. We want to do this now. Now we see why you were doing what you've been doing the last few months. And now her whole family is on the bandwagon. And she's gone on and did like a little educator course through Colin Powell. And she teaches people this stuff because she was so empowered. And I worked with her for months before this. And she wasn't ready to make the plunge until she came and she tasted what it could be and that it wasn't deprivation. So it's a great way to get people in your fold, and we'll teach you how to do it at the event. Okay, so Shine Live Conference, Shine Conference. Oh, that's the wrong one, but it's the same one. ShineConferenceLive.com, ShineLiveConference.com. And I've got the special reward, like I told you. I've got two different things. One is all the hormones of the gut, so you can look at that chart. It's a really cool chart that I put together. And that's at digestivemastery.com/go/gut hormones. And team, if you could put that into the chat so people can see it and click on it, that would be great. And then the vibrant gene charts. Right now, these slides are not there. But if you go there and it's not there, then know that I'll be sending you an email with the link to these. We still have to get these out and downloaded and put on our website. But you'll get a link to the important charts in here. I'm not going to give you all 118 slides because you don't need them all. Some of them are just pictures, but I want to give you the ones that make sense clinically, that have references on them, that have lists, that have hormones and foods. So that gene charts that you're going to get will include, it's about 15, 20 pages of different related SNPs related to foods, SNPs related to using foods, SNPs being single nucleotide polymorphisms. If you don't know what all that is, go to my Facebook page, and I did a talk on it last week, but I'm giving you the slides, the main slides from that presentation, because they're great to have for reference. And, how do you know if somebody should be eating animal fats or not? How do you know if they can handle fats? Some of the genes will tell you that. I want you to change lives. I want you to just be who you are. Don't be afraid to be who you are in your practice with people. Be vulnerable and really connect with them, and you're going to change their lives. You only have to be 3 steps ahead of them. Only have to be a few steps ahead of them. And if you're doing your own thing and you've been changing your own life, you're a few steps ahead of them. Now come to Shine and we'll skyrocket that. We'll take you way ahead of that. And you'll have the ability to really help people on a deep level and empower them. More and more people are educated these days. So if you're, from IIN and you've gotten trained there and they've given you some basics, a lot of the people you're going to work with already know that stuff because they've been attending summits, they've been reading a lot of journals, they've been on the webs. You want to be ahead of them and you want to be able to explain to them why. When you can explain to them why what you're telling them works, they're all ears and they do it. I remember doing that with somebody, and she told me afterwards she was having trouble with, she knew she shouldn't eat Cheetos, right? And she knew she shouldn't drink certain things, but she'd go out with her friends and it was just this social thing and she'd do it. And then she worked with me in a 6-month training program where it was training and coaching. And she said to me at the end, after she'd lost like 60 pounds and was looking phenomenal, she said, you know what? You ruined Cheetos for me. And I laughed and I said, what do you mean? She goes, it was really hard for me to let go of them. I knew they were bad for me, but I didn't know why, and I just didn't pay attention. But when you started explaining those fatty acids and the inflammation and the way it affects my hormones, she says, every time I look at a Cheeto, that's what I see, and I don't want them anymore. So I'm like, yes, accomplished. That's what we want. That's what we want. So here's just some last minute things. If you're on the fence and not sure why, you're going to learn a ton about how and why to use functional medicine. Root cause, not just symptom management Band-Aids. You're going to have these great speakers who I've already told you about. They practice what they preach, and they've been in practice for a while. You're going to help find your tribe, connect and network with other professionals on the same journey. And our tribe, let me just tell you, is amazing. The people that come to this conference and that join our programs are just totally amazing, giving, phenomenal human beings. You're going to get a lot of practice building tools, done for you stuff, handouts and various checklists that you could make them yourself, but it will take you a long time. I've spent 15 years of my practice creating content, and you're going to get some of that here. You'll get all of it when you join my nutritional endocrinology practitioner training, but you'll get a good ton of it here. You're going to get some live demos and actually see how it's done, and I'm going to teach you how to do this with your clients. You're going to get self-care breaks, so we're going to be dancing, moving, doing yoga, doing a little massage on each other's shoulders. We're going to have Qigong in the mornings, and you're going to eat phenomenal food, assuming you upgrade to VIP. So there's no reason not to do VIP. There's some gifts and prizes. We have very generous sponsors who donate. We've had times when we've had Vitamixes, we've had juicers, we've had sprouters, we had dehydrators, and a lot of little things. So we have prizes at every break. So most people walk away with at least one prize, if not more. At our practitioner events, we also have raffle prizes of labs. So the labs generously donate the lab testing that you can get. So one person last year won a Vitamix and didn't need it. So she actually gave it to the person she'd made friends with there. And they just met, but she was like, I don't need this here. You can have it. I mean, the generosity in this community is it's just beyond words. So that's why you need to be here. When you consistently and confidently handle the tough cases no one else can solve, you become that go-to practitioner, and people line up to get your help. People laughed at me when they said, oh, you're being overly salesy. They call you a miracle worker. I have people who get on the calls, and I had somebody every day while I was coaching her, hello, miracle worker. How you doing, miracle worker? I have had people get on and say, you are a miracle worker. In my family, they call you the miracle worker. We're not miracle workers. We're just enabling the miracle of their inner healer. And you can do it just as well as I. Just let me teach you what I know. It's taken me 25 years of my own my own practice, 5 years before that of being in education and training, and then a few years before that of learning on myself and being my own guinea pig. I want to teach you this and make it a shortcut, because you know why? Because I don't want anybody else's mom and dad and sister dying when they don't need to. I want every practitioner out there to be telling people this stuff. And we have a few medical doctors that are going to speak, Skype in, I think. I'm not sure if they're going to be there in person, but to tell us what this has done in their practice. It's phenomenal. You deserve to be at the cutting edge of this. And if you're struggling with your practice, come and join us. When you teach your clients that nothing tastes as good as healthy feels, and you tell them that they don't want to exchange what they want in the moment for what they want the most, which is what they do, right? Oh, I want chocolate cake, so I'm going to give up my energy tomorrow because I want chocolate cake now, even though I know it's going to screw me up. You have the power to empower these people to make the right choices. And if you have the tools and the education, you become unstoppable and you have endless possibility. So I hope you decide to join us at Shine. It's going to be at the beginning of November 3rd through 5th, 2017. And it's in Austin, just east of Austin, Texas. I'll get to welcome you to my hometown. I get to give you a hug. I get to be with you in person. I'm so excited about it. I love this conference. Like I said, it's our 5th one. And every time I get more and more excited about the people that I've met there, the friends I've made, the people who have come and joined our tribe who are now working for me in my practice, because my practice is way too busy for just me to handle. And I've got people who I met at Shine 5 years ago that are doing that with me. So I encourage you to step out of your comfort zone. If you don't like to leave the house, come out and meet these amazing people. For those of you who are in CMDS, Clinical Mastery of the Digestive System, or IRSPT, Insulin Resistance Practitioner Program, or NEPT, Nutritional Endocrinology Practitioner Program, and even if you're in ERC and you're listening to this, I haven't sent you if you're in ERC, but contact me and I'll send you the bonus ticket link. You guys get a bonus ticket because you've invested in yourselves through another program of mine, and I'm happy to welcome you on my dime. So for those of you who want the free ticket rather than pay it, all you have to do is join it's not a VIP ticket, it's a regular ticket, but you just join one of those programs. And if you want more information about that, just contact us. Go to this page for this Shine Conference event or shineliveconference.com, and you will find it. Click the link here. You'll see a little chat box there. And if you are saying, well, how do I get that free ticket? Can I join that program and then get a free ticket? Go for it, type it there, and our help desk team will help you to do that. If you're in the bonus, just click on this link and they'll give you that link. So if you're in ERC or you're in any PT, you just have to say which program you're in and what your name is. They'll look you up and they will give you that link, or just check your inbox because I sent out an email yesterday about it. Thank you, thank you, thank you so very much for being here. Team, I hope you put that Shine Live Conference link into the Facebook so that people can see it. I'm going to take off my mic. There's the camera. There. I'm here to answer your questions. And I want to make this as valuable as possible. I know we went way over. We went to 2 hours. We thought we were going to go to an hour and a half. But I'm happy to stay for another 15, 20 minutes and answer your questions if you have them. But I really highly intend and encourage you is to come to the event, because the event is like nothing you've ever been to before. And I go to lots of events, and I always like mine better, even though they're a lot more work because I have to work them. So let's just see. My team created a folder for me so that I can look at with, let me find it, with the questions. And now I'm having trouble finding it. So let me go back to my Skype. Q&A doc, here we go. What do you mean Zoom is not turned on? Zoom's been turned on the whole time. Oh, I know. I started. Yeah, I started and jotted. Yes, it's on. All right. So let me see. So again, if you want those slides, that link has been posted. Make sure it's posted on the Facebook group as well. The two links that I had here before, you guys have them. So the ones that say "Stay to the end," make sure those are posted in the chat. You can pin them if you want. Let's see. All right, we have a bunch. Let's see. Diane wants to know what foods will eliminate hot flashes. And here's what I'm going to tell you. It depends. Like what food might work for one person isn't going to work for another person, right? And you probably asked this towards the beginning before I actually explained it. But, you know, there's foods that can. I've had people do really well with black cohosh to eliminate hot flashes. I've had people who it doesn't work with at all. You want to eliminate the underlying cause. But if you want to look for Band-Aids while you're looking for the root cause, you can try a variety of things till you come up with that. Gaia has a cooling combination. There's black cohosh. There's a bunch of stuff like that. Patricia wants to know mitigating actions for menopausal symptoms. Hopefully I answered that already. So if you still have those questions, pop them in again. But I went through that a lot. We went through the brassicas being super important, some of the herbs, etc. I don't know what it means, latex allergy and food pits. Is there a question? Oh boy, there's just a bunch of comments in here. These are not questions and I have no idea. Oh, this is what you guys wanted to learn about. Okay, now I get it. So yeah, so Diana, so I would love you to type into the chat. If you're still, if you've learned what you wanted to learn, great. I'm going to touch on bioidentical hormones. Because Evita wanted to know about bioidentical hormones. And, you know, we said that we want to balance everything else. Now, bioidentical hormones are perfectly fine. People say, are they dangerous? Should I not have them? I'm miserable. They are great Band-Aids and they are great life preservers. And some people need to, they just need to have them to get through to the point where they can even focus enough to make the foods, right? But we want to always look at the underlying causes. It's not your age if you have imbalances. When people lose their ovaries because of surgery, you need bioidentical hormones, right? If somebody has damage through radiation or some other things, had a big cyst that had to be removed and the ovary might not be working properly, you need it. As long as the hormones are bioidentical in physiologic dose. This is a critical piece. Highly recommend that you look at the Target method by Dr. Rosensweet if you want more information on that, because he handles it beautifully. But the point is physiologic dose. Get it? Physiological dose, not big doses, not enough to make a menopausal woman have the hormones of a 37-year-old. That's not physiologic, and that's going to shut down the ovaries even more. Physiological to make up the difference, and then you figure out why. Bioidentical hormones, again, a lot of people want to know about bioidentical hormones, hormones related to appetite. Download that chart, and we have a whole topic on that in our nutritional endocrinology or a CMDS class, hormones related to appetite, ghrelin and adipoleptin and leptin. Edie says, I'm a registered dietitian. I want to know what foods support estrogen beyond flax. So hopefully you saw that today. You had that whole seed rotation of the brassicas you learned about, the sprouts, a lot of the foods that we talked about today. So great. I'm glad that you asked that. Great. So Angela wanted to know more about that. So we hit on that really, really well. So any questions that you still have, you can add, but I'm just going to go through and see what you guys wanted to learn. Minimizing estrogen dominance, we talked about that. Fibroids are tough to reverse. It usually is estrogen dominance, low progesterone. Some people have good results with Vitex, but try that seed rotation diet as well. Hypopituitary, what foods to cover adrenal, thyroid, and foods to avoid in a person with too much estrogen. Again, I talked a lot about that tonight. We are going to go in way more detail on that in the event. There's no way I could cover all of that in a short event like this. But the basics, like I talked about, those 7 foods, they have effect on adrenal and thyroid as well. So you can start with that. Oh, great. So we have a reflexologist. We have nurses, social gerontologists. I love your concept about food as medicine. Want to hear more? Great. I'm glad you're here. Glad you came. Foods to avoid in a person with too much estrogen. We told you about those. I had that thing about the charbroiled and foods that enhance. You might have to be careful with soy, although there's mixed feelings about that. Foods that disrupt hormones. Great. These are great comments, and these are all the things. I was confused because I'm looking at it as comments. So these are foods related to hormones related to appetite, and those would be leptin and ghrelin, the main ones, but there's adiponectin and some others. Estrogen and UTI, epithelial lining foods, how to regulate vasopressure when urinating too much. That was not a topic here, and I don't know that that's a topic that topic we go through in our kidney and bladder in nutritional endocrinology. How can I find a functional endocrinologist? So we have within our program, we have functional nutrition practitioners, and they can help you a lot. But if you're looking for an endocrinologist that has prescription rights, that can actually write you prescriptions for bioidentical, I would say go to the IFM site and look at their list of people, and some of them are endocrinologists. Can PCOS be helped with nutrition alone? I've seen it helped with nutrition alone, nutrition and herbs and foods. Yes, people want to put people on metformin, and I don't think it's absolutely necessary. I've seen it reverse. Raj wants to know good ways of eating cruciferous. You mentioned it. Cooking, fermenting, combining with seaweed. I love combining with seaweed because you get the benefits of both ends. So those are all great ways. I like steaming broccoli, cauliflower, and what's the other one I do? A cabbage with some zucchini, which is not cruciferous, but it gives it a nice flavor. And then I take all that and put it in the blender with the water, and then it makes a nice, smooth, creamy. And I put some coconut butter or fresh coconut or coconut milk, and I put in some Thai seasoning. I love the little jars of Thai Kitchen curry paste. Blend it up, a little pinch of salt, sea salt, and then I will pour that over a bowl of arugula. So if getting cruciferous, I'm not cooking the arugula because arugula doesn't do well cooked. I'm just warming it up and softening it. Oh my God, that is like a hormone wonder. It's an amazing food, amazing food. Wow, Melody, congratulations. I changed to food and lost 84 pounds, size 18 to 4. Woo! This is the power of food, isn't it? And I see Beatrice. Thank you, Beatrice, for being here. Beatrice lost 110 pounds by doing our protocols and reversed her Hashimoto's. So good job. Janine, I studied black cumin oil, which may be on bottles, black cumin seed oil, and make sure to mix a teaspoon with warm liquid or honey. As with any oil, it can upset the gut. The seeds you can blend into a tablespoon in a smoothie. Yeah, so that's a great idea. But also with the oil, I think you might be able to also make it into like a salad dressing where you'd mix it with like some tahini. You can mix it with some other things and put it as a salad dressing with like lemon juice or vinegar. So there's a lot of ways. Michael wanted to know how to determine which mushroom, but we said, you know, the shiitakes are the best. So start with the shiitakes if they can afford it. If not, go for the button mushrooms. What is the best choice of mushroom-wise for those who don't like mushrooms? Well, you can get a powder, and you can hide it in an elixir or a smoothie, and you won't taste it. So those are good. And shiitakes come as dried, and you can grind them up. Yeah, so the shiitakes, I think, are the tastiest, quite frankly. Mary, where can I get access to hear this again? Just come back. It will be posted on Facebook right after. How to seed cycle if in perimenopause and not cycling regularly? I do it like a male. Great question, right? Like we had the male, just do it with the moon cycle. Are you asking about the seeds, Jeanette? It was recommended daily dose, take 1 teaspoon daily. In terms of the, I don't know if you're asking about black seed or if you're asking about the seeds. Do you have a recommended probiotic for fermenting foods? It depends on the person, of course. If they have a SIBO condition and they don't tolerate many of the probiotics, I would go with Bifidus. But I personally use the Health Force Nutritionals Friendly Force. And I like powder because you can get more bang to the buck. I also like custom probiotics. They have some formulas there too. They're expensive, but they're very, very potent. To cover my question, meaning foods, and after hearing all 7 foods, I'm confident, yes, there's plenty. Yeah, completely back to the moon phase. Would the last eclipse cause cycle change? You know, that's a good question. And I'm not really like up on an expert in the energy fields and the astrology and stuff, but I think an eclipse can probably cause cycle change. Any like real stress can, and that was an energetic stress in the environment. 2.5 weeks late. That's interesting. I bet. Yeah, I bet. Michael, are you providing this PowerPoint deck? If you go to that link we gave you, we will give you the key charts in here. I'm not going to give you the whole deck, but I'll give you, because it's 118 pages and a lot of it's just pictures, but I'll give you the stuff that has significant charts and information and links. Is it too late to start this at age 62? Absolutely not. Postmenopausal 10 to 15 years, haven't slept well in years. New doctor wants to start me on progesterone. You want to get to the root cause, Marcia. That's why, and if you're not a practitioner, you need to find, and even consulting with somebody in this community, and you can reach out to us click on the link to the page for the event and just mention that that's what you're interested in. We'll have somebody call you back. But we have practitioners who can help you to really get to the cause, right? Because doctors usually have like this 10 or 15-minute window to see you. They look quickly at your labs, and then they try to just throw stuff at you. It's not too late to start at 62. I'm 61, and I started when I was in my 20s, but I've seen people start later, and you have the right to feel great. I mean, I feel phenomenal all the time. And I want you to feel that way too. So I would say you need somebody more of a health coach to help you work with your doctor. And if the progesterone's needed, it's needed, great. But work with a health coach that's trained in nutritional endocrinology that can help you with this. Phyllis, if the testosterone is high, then you don't want brassica or leafy greens because you don't want this to be high. Well, most people don't have high testosterone. So yes, if you have high testosterone, it's different. It's a different story. And you'd want somebody who can look at your numbers. I recommend the Dutch test because it's not just a matter of what's high, but what are the metabolites doing? So you can figure out where the breakdown is. Janine, yes, once you register, you get the link to the hotel and you get a special discount through us. It's like, $75 off the regular rate. Are the previous Shine conferences available for purchase? Yes. Lynn, is there a way that they can go? Make sure you post that. I think if you go to my site and you click on videos, there's an all access pass where you can get all of them I think it's like $9.97, or you can get them each for, I don't remember the exact price, but that's great. Valerie said, I agree that this tribe is amazing and I'm just getting started. Yes. Hope you're coming to shine. I think you are. Thomas wants to know, how do you feel about mental health or substance abuse clients and nutrition counseling? Whew. I think it's hugely connected. And if you join the program, if you come to Shine, you're going to get that brain program where we talk a lot about neurotransmitters. But brain chemistry imbalances, gut imbalances lead to brain imbalances and substance abuse. Zinc deficiencies, just so much related to it. Yeah, absolutely. Absolutely. Okay, so I think that was all. I'm going to go back to the live one. I'm going to go back to the Facebook and see if I can see any there. Let's see. We have a lot of people joining. Heather. Hi, Heather. I haven't seen Heather in years. She's one of my old friends from Austin who hasn't lived here. Let's see. 11 shares. Guys, share. Share, please. All right. Huh. Why does this have the wrong thing? I'm looking at the wrong one. Why does this have the wrong? That's interesting. I might be looking at the wrong one. All right. Interesting. It doesn't look like that. It says what the right name of the conference, even though I put the right name of the conference in. So that's kind of interesting. All right. So I'm not able to see comments on the Facebook. Sometimes I can and sometimes I can't. I just haven't figured it out. It's just a mystery to me. So what I'm going to do is, if there are any more questions on the Facebook, if you want to let me know who to say hi to and who's making comments on the Facebook, I'd love to see those too in that document, so I can say hi to people. It doesn't have to be just the questions. Let's see. Let me see if there's any more questions. Yeah. So those two. If you get the gut hormone symphony chart, and that'll talk about all the gut hormones, and then the gene charts, we're just going to slap on the slides from this one. So go to drritamarie.com/vibrant/gene-charts, and that will get you access to slides, not the whole set because you don't need the whole set, but it'll get you access to the ones that have information, like those 7. The ones about the different 7 foods, and the ones with the links to the studies and all that. So it's probably about 30 different slides in there, that maybe a little bit more. All right, let me go back and look at where we're at here. See if there's anything more in here. Deborah, the last link was for the Shine charts, but I think she said that there'd be charts from the talk. Yeah, you go to the one that says gene charts. Right now they're not there. We have to get them in there. We didn't have time today to get them all uploaded. It took us a few days to get the gene charts formatted properly to get them up there. So yeah, and you'll get them in the email. But you have to sign up at that link so that you get it, so I know who was on the call and wants them. Edie, links provided thus far don't work for key slides from tonight. So can somebody check that link out? And let's see. Oh, did anybody put them in? I don't see those in here. Oh, there's gut hormones. Where's it? Here we go. That should say gene charts on it. Yep, it does. So it'll say gene chart bonus for nutrigenomics. We'll edit that so that it has both on it. But if you go there now, you'll get the email follow-up that has it. So go there now, and when we get the email updated, we'll get those out to you probably by tomorrow. Okay? And then the gut hormone ones, that should work too. Yeah. There you go. Oh, I also have the video. So that's an extra bonus. I forgot I had put the video on there. So if you do the gut hormone one, you'll also get a video that explains the gut hormones. So that's really good. My friend is taking Titulia. I'm not sure what that is and trying to get off. I don't know, Michael. Okay. Okay, great. Thank you, Lynn, about the slides. The link for the slides, put it at the top, Lynn, and you guys see it? So the first one, it says slides for tonight. That's the ones. And then the other one is the gut hormone one. And that's also got a video. So I just realized there's a video with that. There's no shortage of information. And here's what I want. I don't want you guys to stress yourself out. Like, I have to learn all this. I have to learn all this. How am I going to learn all this? If you want to learn all this, you do it like one step at a time. Like they say, how do you eat an elephant? Which I think is a horrible analogy, but one step at a time. Lynn's been in this program. She started out, came from IIN. She'd been self-studying for a long time. She joined our program 3 years ago. And you see how much she knows. It's because she just is consistently going to these webinars, taking notes, and coming to all of our calls and asking questions. And now she's answering the questions. Now she works and coaches people. And that's what I'm also looking for. So when you come and meet me at Shine and we get to know each other and I see the value there and you come and become a part of our community, then you have the opportunity, if that's something you choose, to supplant your own income from your own practice with getting income from working with us and getting experience with working with us. So I typed the link to the chart. So I'm going to undo Mary's question. Is there a connection between digestion and headaches? There can be, very much so. Toxic headaches, absolutely. So really looking at the digestion and healing leaky gut and dysbiosis can have a huge impact on headaches. Absolutely. Hormonal imbalance. You know, we get people who have their hormonal headaches right at that time of the month, whether it's at ovulation or right before their period. Lynn said this program has been a huge confidence builder. I have seen Lynn go from being, you know, timid and not sure she knew as much as she should to like, oh my God, I learn from her every day. So yes. Yes, Janine, use the link in the email that you got. That's your discount link. Okay, let's see. Okay, see a couple of others. The link for the Shine. So we put those in there. So I'm going to undo that. Edie, I put those in there. Anybody else still having trouble with links? Just let us know. And yeah, so Deborah, just to clarify, I said a couple of times that right now the only thing there are the genetics. The second one that has the genetics, that's where you're going to get an email from it. And we'll be changing that tomorrow to have the right link to it. You know, the both of them on their page. So there's a lot here. I talked a lot. All right, I talked a lot. I gave you a lot of information. Lynn always tells me I give too much, and I don't know how to not give too much. I try to cut it down. I try to go, I'm just doing the basics. And I don't want to waste your time, but I also don't want to overwhelm you. There's a lot more to learn. It took me years of repetition. I worked on myself for 3 or 4 years. Then I went to school and did chiropractic school with an emphasis on nutrition. I did a nutrition master's. I did my acupuncture training. I just kept learning and I kept applying it to my practice. And I created this system that works, a system for leaving no stone unturned, a system for helping you where other practitioners are not getting help, a system that I teach to medical doctors who have been in practice for 15 to 20 years who say, oh my God, I wish I learned this in medical school. It's a system I teach to people who are coaches, health coaches, to nutritionists, to dietitians. I was always the person that my classmates would say, can I have your charts? When I was studying in school, can I? And they'd call me up after I graduated. And I'm like, were they sleeping through school or do I just have some kind of special knack for this? And I thought, well, maybe I do have a special knack for this. Everybody's asking me. I need to train them because I can't keep locked inside of here. I want my knowledge and the skill set and the systematic approach to live way beyond me, way beyond me. That's why we founded the Institute of Nutritional Endocrinology. And we're training other practitioners to work with clients who want that. And I want this to be my legacy. And I want you to be part of it if that's what you're inclined to do. And the way you start is to come to Shine. And we meet. And you become a part of the community and you get engulfed in the energy of these amazing people. And I really, really look forward to that. So I'm going to look to see if there's any more. The videos from past Shine events, I think Lynn said you go to my website or you come to this event and you can do it. At the event, we always offer like a bundled special price for the previous year's stuff. Nothing like being there though. The videos are great and you're going to get great information, great charts. You're going to have this really great system for getting started, but there's nothing like being there because the the environment is contagious. The people are amazing, and the information is great. All right. So, yes, thank you, Valerie. I see this tribe. I'm looking to see if there's any other questions that I didn't answer. Okay. Yeah, these are all I answered. Great. All right. So super. Was this helpful, guys? Did you get what you came for and probably a whole lot more? I want to know. Just type it in the chat. Thank you. Thank you, Valerie. She says, thank you for doing another great life-changing presentation. This is what I'm called to do. I work tirelessly at doing this. I want to take everything that's in here and get it out there. And we do that. We do probably at least once a week, sometimes 2 or 3 times a week. We get together with our nutritional endocrinology students and we do cases and we talk to them. We get together with our digestive mastery students, our insulin resistance, and we ongoingly, I want to share what I've learned. And that's the way you're going to learn, is to take what I've learned and put it into practice. And, yeah, you're going to make your own mistakes. I remember saying that to my mom. She'd say, I just want you to learn, I want you to learn from my mistakes. And I'd say, I want to learn from my own mistakes. But there is a value to learning from somebody else's mistakes. There is a value to learning from somebody else's positive experiences. And I've had a lot of positive experiences where people have been to many practitioners. And I thought, what else could I add? But because I have a systematic approach, which I teach, that we don't leave any stones unturned. We don't jump in and handle hot flashes. Yeah, we might throw them a life vest, but we work back to find the root cause. It's really important because remember that picture of the house, right, that burned down because somebody took out that detector, right, that battery out of the smoke detector. If you do that in your body by suppressing symptoms, and I don't care if it's from herbs or drugs, either way, if you're just suppressing symptoms, that's it. The house is going to burn down because you're just turning off the signal. You're not getting rid of the pathology. So I thank you guys from the bottom of my heart for being here. I really, really appreciate your time and your attention, your dedication, because we're the ones that can do this. We are on the brink of this kind of medicine, quote unquote, this kind of healthcare, replacing our broken disease management system and creating a truly balanced healthcare system where people get advice and empowerment on taking charge. We're the start of this. We are pioneers. Not always easy to be the pioneers, but that's where we are. And the more education and the more community you build, the easier it is for you to be like one of the beacons and the shining lights in that. So I want to share everything I've learned over the last 25 years and working on it. So thank you very much and much love. Many blessings to all of you and have a great evening. Bye. Paulo says, cannot thank you enough. Wow, gratitude. Thank you. Cynthia, thank you a million times over. I'm thrilled to have found you. Yes, thanks. I love your joy for teaching us. Mary, as always, Dr. RM, amazing talk. Wow, Susan, I'm getting teary-eyed just reading this stuff. Thank you so much for such a plethora of information. Deborah, thank you. And I look forward to meeting you all in person because when I have, it's like, I can't wait. Paulo, I want to meet you. I've read your stuff so many times and all of you, I just want to meet you and be together and see, like, let's do it at Shine. We've already got the form set up. We've priced it such that it's really reasonable for what you get. We're only charging you for the food what we have to pay for the food because it's expensive to get foods at hotels, but they're doing it organic. They're doing fermented foods. They're doing the seeds. They're doing the nuts. They're doing all the veggies, like tons of veggies and sautés and coconut stir fries and lentils and all kinds of really amazing foods. So thank you, thank you, thank you. Bye now. Oh, a couple more. Thank you so much. I'll be definitely joining here from here on out. Won't be able to come to Shine, but will be participating in all I can. Thank you, Cynthia. Janine, wonderful. Thank you to spend time with you as always and learn something new. Blessings. Thank you for your time. Always from Paulo. Always love. Thank you, all of you. Wow. Wow. Deborah, what is the Facebook page? It's somebody could put that up, but if you go just type in Institute of Nutritional Endocrinology, we have a Facebook page there, and you can see I have tons and tons of Facebook Lives posted on there, interviews with various practitioners who are my colleagues and friends, but also with me alone. And I'm going to be doing more. We're going to be starting to do at least one a week, and hopefully between now and Shine as well as after, but I really, Shine preparation takes up a lot of my time, but I want to do at least one a week because we need this support and we need to come together as a community. Okay. All right. Bye now, everybody.